So I'll do my opening statement and then I'll pass it to you, Chief Martinez. So, all right. Oh, and I should ask, are we ready on the central staff side for us to get going?
Ready to go when you are, Madam Chair.
Perfect, wonderful. All right. I'm calling this hearing of the Boston City Council's Ways and Means Committee to order. For the record, my name is Kenzie Bach. I'm the District 8 City Councilor and also the Chair of the Council's Ways and Means Committee. This hearing is being recorded. It's being live streamed at boston.gov/city-council-tv and also broadcast on Xfinity Channel 8, RCN Channel 82, and Files Channel 964. The Council's having about 35 working sessions and hearings focused on every aspect of the city's proposed FY22 budget. We do encourage you to testify. So I know there's a few people already signed up for public testimony today. If you'd like to sign up, you can go to boston.gov/budget-testify. Come and join us in the Zoom. There's also a way there to upload a video of yourself, which we can play as an attachment to a future hearing. You can also send an email to ccc.wm@boston.gov. That's WM for Ways and Means, so ccc.wm@boston.gov. And on June 3rd at 6 p.m., we'll be having a dedicated public testimony hearing about any and all aspects of the budget. So if you aren't able to come to these daytime hearings and you want to make your voice heard, feel free to sign up and come join us June 3rd, 6 p.m. You can find the full schedule of hearings at boston.gov/council-budget. And you can always informally tweet at us with hashtag BOSBudget, BOSBudget. So we hope you'll participate. Today's hearing is on Dockets 0524 to 0526, orders for the FY22 operating budget, including annual appropriations for departmental operations for the school department and for other post-employment benefits. Docket 0527 to 0528, orders for capital fund transfer appropriations, and Docket 0529 to 0531, orders for the capital budget, including loan orders and lease purchase agreements. That verbiage is the whole set of dockets that makes up our budget formally, but our focus area for today will be the Boston Public Health Commission, the Boston Emergency Medical Services, and our Office of Health and Human Services. And so we're excited to have a full complement of staff from those various agencies with us today. And I'm also joined by my colleagues, Councillor Matt O'Malley, District 6, and our Council President Pro Tem, Councillor Anissa Savi-George at large, Councillor Michelle Wu at large, Councillor Liz Braden, District 9, Councillor Julia Mejia at large, and Councillor Andrea Campbell, District 4. Thank you to the colleagues for joining me. Without further ado, I will pass it over to Chief Marty Martinez.
Thank you, Councillor Bach, and thank you to all the councillors for being here today. We appreciate the opportunity to share a little bit with all of you about our work. I'm glad to get started, but to be joined mostly by some of the city leaders who've been hard at work during the pandemic to keep our city safe and have worked countless hours on behalf of all of our neighbors. As the cabinet chief, where these departments that we're going to hear from today all live, I'm proud of the work they have done, and I'm glad that they can share a bit about their work moving into fiscal year 22 as they continue the amazing work that they've done throughout especially this last year. I want to take just a few minutes to share with you some of the health and human service priorities going into this next fiscal year and the work we will do in partnership with the 10 different departments that make up our cabinet. While each of these departments will continue the important work they're doing to break down barriers and create real opportunities for all Bostonians to thrive, they will continue taking an equitable approach to recovering from this pandemic, which will be needed to come out of this better than we entered it. It's one thing to talk about it, it's another thing to do it, and the HHS departments will be doing exactly that. For HHS, our role is to provide leadership and strategic oversight for the work that is happening across this front. We're going to focus on a few key areas this upcoming year as we work to recover from what has been probably one of the most difficult years in our city's history. We will focus on the health equity work that has shaped our response to COVID, while continuing the important work focused on the Health Equity Now plan that is going to be released to the city by the Health Equity Now Task Force over the next few weeks. That plan is a series of recommendations that the task force created about how the city can recover from COVID in the most equitable way possible. And HHS will take many of those recommendations and strategies and seek to implement them. We will continue that work and continue that partnership with community leaders to to keep the focus on health equity as we come out of COVID. We're also going to continue our targeted efforts related to youth homelessness in partnership with D&D to create more access for young adults experiencing homelessness. This is work that we've been doing for the past 2 years and is now being formalized in our budget. We've been a key partner in the Rising to the Challenge plan to end youth homelessness over the past 1.5 years, as have our partners on this in this hearing as well. We will continue to support that work with a dedicated staff member whose work not only to respond to youth homelessness issues during COVID, but also to create additional strategies to support those most impacted by youth homelessness, LGBTQ youth and youth of color, who continue to be those folks who have the least amount of resources into this new fiscal year. We will also support the ongoing work of the administration to strengthen the city's response to the substance use epidemic that is impacting our residents and has grown in impact in specific neighborhoods. We've spent the last year in partnerships with many city departments and leaders in shaping our response, and know that while progress has been made, more work must be done. And you'll hear more about that work over the next hour or so within this hearing. We will continue our expansion of the strategic work focused on violence prevention, intervention, and recovery, and will continue to invest in resources for youth development organizations that need dollars on the ground to support their work day in and day out, which we did in this last fiscal year, and hope to grow those resources in the next fiscal year. Finally, we will lift up a mental health initiative to ensure that we are creating real access for folks to get the care they need to recover from the issues that they are facing post-pandemic. This will include efforts to destigmatize getting mental health care, ensuring there are clinical supports from diverse communities and providers who can serve those communities, as well as investing in those entities that can provide the kinds of support we need in schools and with young people and with targeted populations as well. We know recovering from the mental health challenge that has been COVID will take much focus and work, and that is part of the work we will do in this upcoming fiscal year. In addition to that work, my office is providing leadership to the administration's efforts to a few different fronts. We will continue our work around Long Island and the advocacy needed to see that become a reality. And we were also taking leadership in the work to create alternatives to policing and strengthening the city's mental health response on the ground. We've been actively working to create a pilot in partnership with the Boston Police Department, our best clinicians, Boston EMS, and a variety of other city departments, including the mayor's office, to create a pilot, an implementation plan over the next 90 days so that we can increase the role of clinicians and ultimately reduce the role of BPD in our mental health response. We continue this work and plan within the next 4 weeks to provide the mayor a recommendation regarding a potential pilot that will allow us to increase the number of calls receiving a response from clinicians in partnership with the Boston Police Department. And we're exploring all options, researching options that are happening all across the country, and working collaboratively to ensure that this pilot is both equitable, that the recommendations will advance equitable outcomes for people of color and those who are disproportionately impacted by a law enforcement response to mental illness and drug use. We will have a pilot that's also feasible, that will allow us to make a real implementation plan and put it in place in the fall of this upcoming year. A pilot that will be appropriate, that will promote best practices in terms of response for mental health by identifying opportunities to increase the role of clinicians and, where appropriate, decrease the role of police, and making sure that this pilot's community informed, that residents, particularly individuals living with mental illness and residents of color, will help directly inform these recommendations. We're taking a leadership on this pilot so that we can turn many of the ideas that people have and the desires people have around this work into a reality, and look forward to discussing more of that as we continue this work. OHHS stands ready to support the ongoing work of the administration to finish our COVID response, the emergency side of that, in 2021, and to ensure that our equitable recovery is more than just a hashtag or a quick idea, but one that is focused on turning those ideas into concrete actions to tackle the systemic challenges that exist. With that, I'm glad to pass this off to Rita Neves, the Interim Executive Director from the Boston Public Health Commission, to tell you more about the work of the Boston Public Health Commission moving into this next fiscal year. And again, I can't say enough how proud I am of the ongoing work the Commission and its staff has done through a very difficult year. And I'm eager to have folks hear more about this upcoming year from them. With that, I'll pass it on to you, Rita. Thanks.
Thank you, Chief Martinez. Good afternoon. Thank you, Chairwoman Bach, and councilors for hosting us today. I'm Rita Neves. I'm the Interim Executive Director of the Boston Public Health Commission, and I'm joined today by Grace Connolly, who's our Director of Administration and Finance. Also, Chief Hooley is here present with us, and Jen Tracy and Devin Larkin from Recovery are joining us from another location. Following our presentation, you'll hear from Chief Hooley on Boston's EMS and from Jennifer Tracy and Devin Larkin on Recovery Services. And obviously, Chief Martinez will stay with us throughout the hearing and will answer additional questions as needed. As you know, the Boston Public Health Commission is one of the country's oldest health departments and is an independent public agency providing a wide range of health services and programs. We're governed by a 7-member board of health appointed by the mayor of Boston. BPHC also holds the distinction of being nationally accredited in 2017 by the Public Health Accreditation Board. In this extraordinary challenging year, the Commission's over 1,300 staff members have shown remarkable commitment, courage, creativity, and perseverance. It has not been an easy year for us, but we have remained focused on our mission to protect, promote, and preserve the health of all Bostonians, especially the most vulnerable. Over the past year, we have all truly felt the weight of that responsibility. The Commission's more than 40 programs are grouped into 6 bureaus and 9 public health service centers. Our staff encompass public health nurses, epidemiologists, community health workers, property management, health inspectors, EMS, shelter workers, and more, and all have carried out incredibly important work over the past year. I want to spend some time talking about the 4 key priorities that we intend to focus our work on in the upcoming year. And starting with our work around anti-racism and health equity. BPHC prioritizes its current and future work into 3 categories: response, recover, and reopening, with a focus on anti-racism and health equity embedded in every category. This work is external and shapes how we serve our residents, and it's also internal as we prioritize staff support and creating a more sustainable infrastructure. Next, please. We include this slide to remind us of the journey we have been on over the past year. As you can see, the gray line, it shows current active cases and cases throughout the pandemic. The green line, it's about the folks that have had COVID and recovered. And the yellow line is it's a line representing how many people we have lost to COVID. When the pandemic reached Boston, BPHC sprang into action to address COVID-19 and adapt our services to a new reality. The Commission's responsibility for the local public health response to the pandemic included immediately initiating the Public Health Incident Command Structure and the Medical Intelligence Center. The core activities that this part of our structure had to implement, including developing and implementing the COVID-19 data surveillance systems for the City of Boston, allocating and distributing PPE to healthcare and community partners, interpreting CDC guidance for schools and businesses, faith institutions, and others, mobilizing the infectious disease infrastructure for testing, contact tracing, community education, and later vaccine distribution. And throughout the FY2021, BPHC also simultaneously ensured continuity of care for over 40 programs across the departments, with a particular focus on the direct services programs that remain fully operational for the duration of the pandemic. And that includes our staff in EMS, all of our recovery services and homeless services teams. Next, please. The Boston Public Health Commission understands that there can be no health equity without racial justice. Over the past year, we have continued to build on our organization's deep and long-standing commitment to these principles. Building on our past work this year, we developed a new community engagement plan and institutional policy and toolkit to put our policy of equitable community engagement into practice throughout our programs. We invited residents to share their thoughts on the new COVID-19 vaccines. We hosted about 10 virtual focus groups in English and in Spanish and distributed one online survey. Responses from this survey were used to inform an equitable and effective communications plan, including an FAQ page and a multilingual community information sessions. It also helped with the BPHC vaccine information webpage and a social media campaign and our continuing partnerships with CBOs and faith-based communities. We also continue our equitable procurement initiative, which seeks to increase the Commission's contracts with certified underrepresented business enterprises. COVID-19 resulted in hundreds of contracts and purchase orders. The majority of the PPE that we purchased was purchased from a disabled veteran-owned business, and both our reusable mask and cleaning services for our vaccination clinics have been purchased from separate Boston-based minority women-owned businesses. Finally, we continue to seek to build a culture of racial justice inside the walls of the Commission. Initiatives this year have included updates to our new hire orientations and the development of an anti-racism policy. In June, you remember that the mayor issued a declaration of racism as a public health crisis in the city of Boston, and we received $3 million to implement 8 new strategies to address systemic racism. In partnership with the Health and Human Services and the Equity Cabinet, BPHC co-leads several work streams of this citywide effort. Some of the key initiatives this year have included releasing a racism-free Boston request for information, that help us ask residents and community organizations for what their vision is of a Boston without racism, poverty, and other systems of oppression. BPHC also awarded grants to organizations for 3 projects related to the declaration work. One has to do with funding for community organizations to support and pilot a standard way of collecting race, ethnicity, and language in their day-to-day operations. And the second funding opportunity is to pilot community-based translation. In public health, we know that we cannot fix what we cannot see. To that end, BPHC is working to ensure the availability of specific race and ethnicity data that documents the health inequities that exist, and to analyze social determinants of health to better understand these inequities. This includes relaunching of the Boston Health Equity Measures Set Advisory Council, and also retooling our Boston Behavioral Risk Factor Surveillance System and conducting supplemental survey that we did on COVID-19 health equity. When we talk about our response to the pandemic, this slide shows some data points to illustrate the scale and scope of the Commission's COVID-19 response efforts, including just some highlights. The Infectious Disease Bureau received over 53,000 COVID-19 reports and maintained an extensive contact tracing effort. The Office of Public Health Preparedness distributed over 2.5 million PPE items that included hand sanitizers, gloves, masks, to more than 480 organizations across the city. And the commission also distributed over 14 million in grant funding to community health centers to support activities including testing, vaccinations, community outreach and education, and mental health. Next. So even while we were in a response mode, we knew that we had to maintain the delivery of core services, particularly for our most marginalized residents. For some programs, this means adapting to the virtual world, while for others, it meant figuring out how to remain in person safely. So even while the Infectious Disease Bureau was dealing with tens of thousands of COVID-19 reports, it continued to respond to reports of other infectious diseases, from flu to measles to some STIs. Our school-based health centers were able to pivot to telehealth while we carried out professional development on an online platform. These pivots were made possible by the tremendous work of our information technology services and team. Some programs like the Neighborhood Trauma Teams Network have continued to offer their valuable services in person, and the Mayor's Health Line was more vital than ever as a way for Boston residents to reach out with COVID-19 questions and be connected with services. When the pandemic hit, individuals experiencing homelessness were particularly impacted, and public spaces, services, and shelters closed their doors across the state. In FY21, BPHC was able to continue serving individuals experiencing homelessness here in Boston, keeping our doors open to new and returning guests. In addition, BPHC Homeless Services Bureau leadership led the city's response to ensuring that individuals experiencing homelessness were safe during the pandemic by coordinating among area providers and hospitals, supporting the opening of isolation and quarantine facilities, by also creating citywide transportation, alert, and communication tools, and also facilitating ongoing testing in our shelters and advocating so that those experiencing homelessness were prioritized for vaccinations. In a massive effort led by Boston Healthcare for the Homeless, over 3,000 staff and guests have been fully vaccinated. We would like to send our thanks to Boston Healthcare for the Homeless for their tremendous partnership over the past year. The Homeless Services also further its vision of a Boston where homelessness is rare, brief, and one time. In FY21, Homeless Services strove to offer diversion conversions to all new guests, with 122 individuals diverted and prevented from having to enter the Homeless Services system. And in fiscal year to date, 235 homeless individuals have been permanently housed. COVID-19 had a significant impact on the BPHC workforce. Our staff are not just dedicated public health professionals, they are also Boston residents and community members who are feeling the impacts of COVID, not just at work, but at home as well. Throughout the fiscal year, about 2/3 of our staff were reporting to work in person on the front lines. Staff experienced 178 positive COVID tests, and had to quarantine 222 times. We have worked to make testing and vaccinations as accessible as possible to commission staff. 1,108 staff documented as vaccinated to date, including among that number, 333 EMS staff. This fall, it became apparent that childcare was an urgent issue for many of our team members. We organized an internal work group on the issue, surveyed staff to understand the problem, and assisted with childcare resources. In the upcoming fiscal year budget, you would see before you that there are 2 new initiatives that I'd like to highlight. One is an employee family support manager, and the second one is an occupational health and safety officer. Both of these positions are to ensure that our staff have what they need so that they can continue to fulfill their vital roles. Lastly, on reopening, internally, externally, the Commission is preparing for a safe and healthy reopening. BPHC has developed metrics to monitor the progress of the city's response, to guide decision-making, and to shape our response moving forward during the COVID-19 pandemic. As vaccine distribution continues, we will evaluate our metrics and make improvements to best inform reopening in the city of Boston. And BPHC works with other city departments, including ISD and the licensing board and economic development, to review proposed reopening plans for local businesses and community events. And we'll continue to work closely to monitor the requests that are coming forward and continue to deal with the challenge of the fact that the public has a perception that COVID-19 risk has decreased and that we can go back to normal without any restrictions. The Infectious Disease Bureau has also been providing support to Boston's 23 colleges and universities for testing and contact tracing efforts. And in terms of our own operation here at the Commission, while 2/3 of our staff continue to report in person, those who are teleworking are expected to start returning to on-site work in the summer soon. And, you know, under the guidelines and strategy determined by the Commonwealth, BPHC, in partnership with the Health and Human Services team, is working to create equitable access to the COVID-19 vaccine across all populations and neighborhoods in the city. We're working to ensure that distribution efforts include accessibility in those communities and neighborhoods hardest hit by the pandemic. And as you know, we have followed this plan where there are two models that have evolved depending on the priority group that we were focusing on. And at this point, we're putting a lot of energy, attention, and resources to increasing our capacity to do mobile vaccination clinics throughout the city so we can meet people where they're at and really remove any barriers to people to come and get the vaccine. You may have seen this already because we continue to share this data on a weekly basis. As of May 18, almost 60% of Boston residents have received at least one dose of any of the vaccines available, and 47% are fully vaccinated. So this is enormous progress, but we still have a long way to go, and we want to be clear that COVID is far from over, and our work to get the rest of the folks that are eligible to get vaccinated in the city vaccinated. Quick show of where do we stand in terms of percentage of folks that have been vaccinated by race. As you can see, the communities of American Indian, Alaska Native are 35.2, Asian, Pacific Islander 72%, 41% of Blacks have been vaccinated, 42% of Latinx, and 61% whites. Next one, please. And lastly, on recovery efforts, during FY21, the Office of Public Health Preparedness continued to support health and social services recovery planning and operations for the city of Boston. OPHP has been working to grow and activate its community resilience network, made up of approximately 220 CBOs, faith-based organizations, and other social service organizations that serve Boston communities. We are convening a number of internal working groups to kickstart recovery planning, maintaining a focus on equity in the COVID-19 recovery. And, in closing, I'd like to thank Major Janey, the Office of Budget Management team, and Chief Martinez for their incredible support, not just in this budget process, but over the entire year. I also want to thank our Boston Public Health Commission Board of Health for their continued guidance and leadership. And, we have worked very closely with our board members on COVID-19 response and are really grateful for their commitment to ensuring that the commission is continuing to build on and improve our public health services. And finally, I also want to say thank you to our IGR and fiscal teams for helping us get ready for today. There's a lot of work that happens pre-hearing for many weeks and months. So I want to say thank you to both teams. And also I want to say thank you to our executive office team and our staff. They are an outstanding team, and Boston is lucky to have this dedicated and talented, diverse workforce, working with us. I'd like to turn it over now to Chief Hooley for an EMS presentation.
All right, thank you, Rita. Can people hear me? I get my sound off so I don't feedback, so I just want to make sure you can hear me. All right. Well, hey, good afternoon, everybody. Good afternoon, Chairman Bach, the rest of the councilors. Well, I have minimized my screen right now. I apologize for that. It's good to almost see you in person. We do certainly miss seeing you, besides at hearings, but at events and everything else. So we normally would be encountering each other all the time and getting referrals from you, meeting other people that you're all meeting with, and hopefully we're going to be returning to that shortly. But for right now, this is the best we can do, and so we're going to make the best of it. My name is Jim Hooley, and I do have the pleasure of serving as the chief at Boston EMS, and have so for 12 years now. And in a lot of ways, I could not be prouder of the men and women of Boston EMS who serve and meet the pre-hospital needs of Boston. I say that knowing that we've had some incredible years with record snowfalls, the terrorist attack at the bomb in April in 2013, the bombings. There's been a lot of accomplishments, but the level to which this department has stood up and sustained efforts all these months with everything that's been going on with COVID, with the fact that everyone else did, and still that we, our own members, just like everybody who's watching this, maybe had children at home or in hybrid schooling or taking care of other people, other family members who may have been furloughed or lost jobs. Now, none of us are immune to any of that. We've all been fortunate to have work, but we're all in this together, and we do appreciate that, and we appreciate probably more than anything what everybody, not just in the commission, does. The people who work in the shelters, the people who work in recovery, who are 24/7 dealing with all of this during a pandemic. But our partners in public safety, police, fire, school department, everybody. That's one thing that this experience from the last more than 12 months now has, I think, really focused on just how much all of us in the city depend upon each other to get things done, every office in the city. And just two things I'll point out quick. It has been an extraordinary year with some challenges, but our personnel have risen to the challenges. Serving our residents with professionalism and with clinical excellence. And I'm just going to bring the mask down a little bit because it's hard to talk right now. Everybody else's ears on. And I'll point out two things. One was obviously the COVID response, which certainly is not over. It's still going on. We're just in a different phase of it right now, right? And our personnel from the beginning try to approach it with caution, using science, using the best guidance from the CDC, and employing good infection control procedures over the years to get us safely through it, and hopefully to keep our families and loved ones at home safe when we did get back, but also to limit any kind of exposure to the public or to the next patients we saw. They were being so diligent about cleaning our equipment. Our folks came up with a lot of different ways to improve barrier protection in the beginning by using plastic sheeting for some things. They used in the beginning when face masks under the short supply. Our division that does materials management was manufacturing equipment. We got a lot of help from the city and other people to help us source some equipment and supplies, and that was good. But again, in the end, it was a lot of our personnel who really stepped up and embraced new ways of doing things to make sure that we could still carry out our mission day to day. And last summer, when as our nation really had an awakening, to the persistent impacts and of racism, inequity, exclusion that became evident. Not just because Minneapolis, everyone realized like that could be on any street corner USA, and the men and women of Boston EMS certainly understand that. The members here. Yes, there's a lot of concerted city efforts, state, federal efforts to address this, but the members here, they weren't shy about trying to get together, immediately in the days afterwards. The union offered up space and hosted a couple of listening sessions for members to come together and talk to try to get through issues, not just here in the workplace, but in the work we do, come up with some ideas to address a lot of the things that are being discussed at many levels now. And they've already put a lot of things into effect. There was a lot of dialogue. There was a lot of proposed solutions and a lot of discussion on necessary changes, which have been embraced. And I'm proud to say that a lot of people here have already put into place. So again, that's sort of why I can say that probably even out of all my years, I probably can't be much. I can't think of too many times I've been more proud of the work of the men and women of the service. Okay, on this slide here, just quickly, this just is an overview of Boston Public Health. And, since 1996, Mass State law, Boston EMS became a bureau of the Boston Public Health Commission when the commission was created. Well, because we formerly were part of the city's Department of Health and Hospitals. For those of you who were around prior to 96, you already knew that. We're a two-tiered system with 21 basic life support ambulances. And we've added in 5 advanced life support, which we during day and evening shifts. We've added 2 additional BLS ambulances due to COVID-19. And even when our call volume dipped because of the closures and businesses being curtailed and a lot of things, we still had to keep up the extra staffing because it was the universe precautions that you were taking on every single call and the cleaning afterwards and the documentation took a little bit longer to turn calls over. So we tried to match that by putting additional units on. We tried to get additional supervisors and support special operations units out there to help replenish PPE in the field and to make sure that we could be ready for the next call when it came in. In 2020, we responded to 115,537 clinical incidents, and that was a 10% drop compared to the prior year. Then that was probably driven mostly by the fact that less people were coming into the city. Hours of operation for businesses, entertainment, and everything were cut, and everybody knows that. And then with, so we had a total of 75,800 total transports last year, which was a 12% drop compared to 2019. Although now we're starting to see that return to our levels. Our daily number of clinical incidents, our daily number of transports is now starting to inch back up as we re-emerge to recovery. In total right now, we have 427 full-time positions at Boston EMS, and 399 of those are for uniformed personnel. Next. And that's just our incidents by priority. Priority 1 being the most severe, acute. Priority 2, a bit more urgent, but certainly not life-threatening. And then priority 3 and 4, which are lower in priority. A median response times for priority 1 incidents up there, our goal in 2020 was 6 minutes, and we were able to maintain that. A quick review of, we have many different type codes and incident codes, but that gives you that breakdown there that you see is how we, if you aggregated them all: illness, investigations, injuries, cardiac related, psychological, and respiratory. That's the breakdown percentage wise across those totals that I gave you. In 2020, we responded to 28,681 of the most urgent priority 1 calls, and we still were able to achieve our 6-minute median response time. I was going to say, we closely monitor our call types across to identify trends and to inform both our operations and other city services. We work with the city's transportation department to use our roadway incident data to inform infrastructure improvements and what may be prioritized for lanes being changed, bike lanes, you name it. A lot of our EMS history for is used to inform some of that. Next. All right. Our personnel are our highest priority. And as you can see on this slide here, this tells you the average age of service for our current workforce by rank. The city has been responsive to our request to increase the number of personnel within Boston EMS over the last few years. We added 20 FTEs in FY17, 4 in FY18, another 20 in FY19, 4 more in FY20. The majority of our members are EMTs working in ambulances and in dispatch operations, with 11% in the rank of paramedic, principally those who are involved in advanced life support ambulances, and another 11% serving in supervisory and command rank staff roles. The remaining 7 are non-uniformed, including mechanics, materials management, budget, IT, communications engineering, facilities, and administrative staff. The high level of service we seek to provide is a combination of both the investment we make in our personnel and the experience that they gather from years on the job. The second chart on this slide over to the right, the bar, shows you the average length of service. On average, our EMTs have 9 years on the job. Those promoted to supervisory and command ranks tend to stay until retirement, and their years of service are reflected in that. We also have very little turnover on the non-uniform side of our ranks. Diversity for our FY22 budget hearing on this chart might be a little bit difficult to see, but I believe you had this presentation emailed to you, but it does remain an ongoing priority for our department, is reflecting the community that we serve. And although we recognize we do still have work to do, we strive to enhance diversity at all ranks. Compared to last year, we increased the number of members of color from 107 to 115, increasing from 26 to 27% of the department. While this may seem small, it does represent a 7% increase in our Asian members, 8% increase in our Black African-American members, and a 12% increase in Hispanic members. Increases in overall department diversity is achieved through our EMT hiring process, which is constrained by the prerequisite of being a state certified EMT to apply here. Our current academy class of EMT recruits is 60% persons of color. It is equally important that we retain members of color, which, as the previous slide showed, is positively impacted through promotions. Diversity at the leadership ranks also positively impacts the overall department culture and inclusion. Second to EMT recruits, the command level deputy superintendent and superintendent ranks combined are the most diverse groups in our department, with 43% of the membership of the command staff, deputy superintendents being members of color. Next, the chart shows the uniform personnel by rank. The total number of women in the department has increased from 32% last year to 34% this year. Our current recruit class is predominantly women. Currently, 13 out of the 20 in that class are female. And through promotions in December of 2020, we saw increases in the diversity of the deputy superintendent rank, which included both race and gender. So again, we still have work to do, but we are embracing that. One of the things that the membership here, and this was grassroots, it grew out of the membership, was the formation of an affinity group here, the United Coalition of Emergency Medical, Service Professionals, or UCEP. UCEP is a department affinity group established in the spring of 2020 and is dedicated to advancing equity and inclusion within the department. It has 60 dues-paying members, and it's made a number of advancements already just since it started late last summer, not even a year ago. Most notably, they've sought to address the lack of diversity in the paramedic ranks. Paramedics do earn approximately 36% more than EMTs, and there are some promotional opportunities that aren't always available to EMTs. While EMTs can be promoted to deputy superintendents and superintendents, and several have in the past, shift commanders right now are relegated to persons who also hold Boston paramedic certification. UCEP has successfully secured over $200,000 in workforce development funding to cover all costs for 16 department EMTs to become certified paramedics through a program at Bunker Hill Community College, and 12 to take additional coursework to secure associate's degrees in paramedic studies. These 16 members represent 75% women, 37% bilingual members, 94% members of color, and 62% are parents who are, and they are all also members of UCEP and committed to its members. UCEP is open to all members of the department. It's the men and women from the department who formed it felt that it should be, they wanted to be as inclusive as possible. There's not a dues paying member. It's open to anyone in the department. And so the idea is for them to advance members to help. Yes, the department, it's still on us to do our part, but that it gives them another means to help provide advancement for members in the department. There's other avenues that become open for them. And again, this is an example of the members of this department stepping up to support each other. Once they complete the paramedic program in 2022, they'll be eligible to apply for promotional opportunities here at Boston EMS. And the members of the Board of UCEP will also work diligently to develop diversity, equity, inclusion, and bias training program. As we're familiar, Boston Public Health has always offered 2-day programs here for advancing anti-racism, for advancing training on inclusion and inequity here for all things. And yes, we welcome that, but the members of this department and UCEP say, hey, we want uniformed members of our service to step up and teach this. And they're embracing, and they're working with the commission, and they're working with the city Office of Equity and Diversity as well to make sure that we're all on the same page as they progress with that. So again, they're stepping up. We are stepping up to meet the challenges. City Academy, we've had good success working with the city's Office of Workforce Development. City Academy, as part of an ongoing priority, our department has partnered with them over the last 4 years. In this, they funded 7 cohorts of city residents who are able to take an EMT course and certification in which the courses are, the prices for the class that we offer here, the expenses for it, the tuition for it is covered by this program offered by the City of Boston. It's been particularly beneficial for residents of our city, and because we do offer this EMT training here twice a year, it prepares them for jobs at Boston EMS. And even if they decide that they don't want to use that at Boston EMS, they could use to go somewhere else. If they say, hey, I kind of like this, but maybe this gave me confidence to go for nursing or something else, God bless them. They got to step up here. We'd rather keep them here at Boston EMS, but again, this is a very good an opportunity where there are actually jobs at the end, because we do hirings twice a year. Because our average attrition rate right now, we've been averaging about 21 people a year between retirements or people who do move on into other careers. And so we do have the opportunity to bring new people on. Next. All right, speaking of which, in our academy, our training division is comprised, we have a superintendent, 5 training captains, an ALS coordinator, as well as personnel who get assigned from the field to support training programs. Each new EMT receives an additional, even though they're already an EMT when we hire them, they get an additional 6 months of full-time training to learn how to become a Boston EMS EMT. We're the only EMS service in the country that does this much training. For paramedic promotions, our candidates who hold paramedic certification, who pass that promotional exam process, have to complete a 3-month field internship and finally an oral review board with our medical control physicians before they get cleared to go on to practice as paramedics here. Supervisors and command staff personnel also receive several weeks of additional full-time training as well. All of our training meets state certification requirements, is provided in-house to personnel. Our training division works with internal and external personnel to augment our training curriculum and to ensure the continued advancement of skills. In partnership with the Boston Office of Emergency Management, we've also coordinated 5 meta leadership trainings in the past 5 years, taught by the Harvard National Preparedness Leadership Initiative. And these trainings have been virtual due to the pandemic. They've not only included personnel from Boston EMS, but hundreds of leaders from across Boston Public Health, Boston Public Safety, Emergency Management, other city departments to promote interagency and interjurisdictional coordination. Next. A quick map of the city shows where those ambulances I talked about are. The red dots actually show where we have stations or garages, and the blue stars of life show where ambulances are sent to post. We have more ambulances than we have garages. So a lot of ambulances crews do pick up a truck somewhere else and then travel off to their response area to cover that. And that's what's represented in that slide. In addition to, okay, I already mentioned that. Okay, and quickly, there is a new training facility and garage, which is well into design and is getting ready to go out for bids for construction on Rivermore Street out in West Roxbury. It's we're incredibly appreciative of the city of Boston for this body, to the mayor, and all the different city departments who helped to make this a reality. Besides it being a new training academy and a place where we can do training out there even 24 hours a day without bothering neighbors. It'll also include a couple of ambulance bays out there to address ambulance needs out in West Roxbury, help augment out in those areas, and also provide site for training ambulance out there as well. Discussions are also underway with Public Facilities Department, Boston Planning and Development Agency, as well as the Office of Budget and Management to address additional needs in other city sections, including the Seaport area, Charlestown, Austin, Brighton, and Franklin Park. Okay, a quick update on our narcotic-related illnesses. So that other pandemic or endemic that we've all been dealing with, certainly has not gone away. And I know the state's cast some light on that with some of its recent reporting with increases that we're starting to see in been 2020 and a number of deaths. But just quickly to say, in 2020, Boston EMS responded to 3,951 incidents that, after review of our documentation, were found to be determined to be a narcotic-related illness. And that's a 1% increase compared to 2019. 2,043 NRI incidents included the administration of Narcan, which represents a 2% increase over 2019. And in October of 2020, with state approval, we launched a Leave Behind Narcan program to the Department's Community Assistance Team, providing Narcan members to a community after an overdose. When you look at that increase in the amount of Narcan given, what's important to know here, it isn't necessarily members of Boston EMS are administering more Narcan. As a matter of fact, we're seeing more and more Narcan over the past few years through many initiatives that have been administered by other public safety, Boston Fire, Boston Police, certainly, but more so through outreach workers, through people who are in recovery services, through shelter workers, through people whose friends and families of people who are suffering from addiction, people who have been trained by Boston Public Health through programs like AHOPE to carry Narcan. It's not uncommon now for us to arrive at the scene of a report of somebody not breathing from a narcotic overdose to find them that they're actually starting to come around from that period. The fact that maybe a couple of doses of Narcan have already been given by one that maybe that person was carrying on them, a buddy administered to them, a bystander who carries Narcan, because perhaps people who both have addictions, they're careful, they try not to use alone, and they're watching out for each other, or there's other bystanders. It could be so much worse, the death rate, probably in the state, but certainly in Boston, had people not been proactive in doing this. A lot of lives have been saved by giving out Narcan. That's why even before we wanted to embrace the idea of replacing that Narcan at the scene and leaving it behind. If a parent has given out Narcan, had to administer it to a son or a daughter who they thought, or a husband who had been doing okay and then relapsed and used, who knows how soon they're going to need that replaced. So it'd be quicker for us to just replace it there to make sure that they have the opportunity to do that again. So there's been a lot of great work done, and obviously recovery will be talking more about that. What I will say is, though, we've also seen, so on the next slide, okay, seasonally, we see the highest volume of NRI accidents during the summer months, and some of the lowest volume occurs some of the winter months. Not sure why that's so, but while we did not see a significant increase in overall NRI call volume from 2019 to 20, we did see a 12% rise in NRI in patients who were either referred to the medical examiner or an increase in cardiac arrest from 114 to 128. So people who we've determined to have had a narcotic-related illness using our definition, there has been an increase in those who were referred to the medical examiner or who we attempted resuscitation, brought them to the hospital, and then they subsequently did succumb. So there has been an increase in that, sadly, in that rate. And again, not sure why that has happened, because we have seen an increase in the number of Narcan that's been given out by bystanders. We coordinate on a daily basis still with members of the Boston Fire, Boston Police, and Recovery Services, sharing information with recovery and coordination on the scene, on where we're encountering people, if there's new sites where people may be using drugs where they're out of public view, which could be a reason why, so there was some increase in deaths, because if nobody sees you go down, then there's nobody there to rescue with Narcan. Next slide, COVID encounters. Okay, to date, members of Boston EMS have had over 5,211 documented COVID-19 confirmed positive patient encounters. Those are Boston residents identified through state numbers who are Boston residents reported to Boston Public Health who are tested positive for COVID, who match up our records for people that we cared for and encountered. This month, we're caring for an average of 2 COVID-19 patients per day, compared to mid-April of last year, when we were averaging 56 per day. So as you can see, the numbers have certainly gotten better. The majority of confirmed COVID positive patients we encounter have either respiratory or general illness type codes, although with community prevalence, we do have to assume that many patients potentially have COVID-19. And that was the case this past winter, where we get persons who were struck by cars, or persons who were in motor vehicle accidents, people who were victims of gunshot wounds, who coincidentally also tested positive for COVID. Call screening was an important part of our COVID response. We as a department began to actively prepare for COVID-19 in January of 2020. That included 911 call screening protocols for early identification of possible cases, which was first instituted on January 27th last year. Way back then, you remember, the screening questions had to do with travel history. Had you been to certain provinces of China, then mainland China, and then the list kept expanding until certainly the travel history became useless, and it was more focused on symptoms of exposure and confirmed illness, and we incorporated those. The call screening progress has been an essential component of protecting our personnel. 80% of those true COVID positive patients that we later identified as having COVID were also flagged as potentially COVID related by our dispatchers and our call takers, who put in a note to monitor the comments. And it just said, no, monitor the comments, which was a cue to the crews to take a look, to say like, hey, take precautions. There's something in this patient's presentation history or what the family's telling us to suggest that they may have COVID. And so that was really the first sentinel we had for it. Personnel safety and health has been and will continue to be our #1 priority. If we take care of our members, they'll be best prepared to take care of our patients. This can include the exceptional work of our peer support program, which rapidly adjusted to the changing landscape, transitioning services and resources to a virtual platform and focusing on holistic wellness. This past year, we hosted a crisis intervention training to expand the number and diversity of our peer support members so that everyone in our department has someone on the team that they can feel comfortable reaching out to. And again, that's important. We do have a very good peer support program. There's certainly COVID has put a lot of stress. There's more EDPs, there's more psychiatric pressure on children that's documented, that's reported by hospitals. There's pressure on our personnel. There's been impact there. And we made it, again, the members of this department said, hey, we want to improve diversity in the members of our peer support team. And we have developed that. We've developed that in all ranks and across race and ethnicity to meet that challenge. And that's been accomplished. In coordination with our training division and the International Trauma Center, we are rolling out a behavioral health training this summer, which will both serve our personnel and their ability to care for patients by also with psychological first aid, yes, but also for wellness for our own members and for supervisors to recognize our own personnel who may be in need of services not just the patients that we're serving. Throughout the pandemic, we've been able to consistently to outfit our personnel with personal protective equipment. And we've also been providing regular access to testing on site for our members. We offer workforce testing here at the commission twice a week. Anybody can come in and get tested. We encourage it. But also anybody who has any sort of symptoms, we're able to get testing in many cases done that day. And sometimes, depending on the time of day, we can get results that day, which is one very good as far as us having to pull people from service, but also how quick you can return them, but also put their mind at ease when they go home. You know, what precautions they have to take there, whether they're going to be test positive or not. We're very grateful to the Boston Medical Center, who extended vaccinations to our personnel in early December. By grace, they allowed us to, they put us under the umbrella of health care providers, which got us into for vaccination, you know, a good week and a half ahead of others in first responders. So we appreciate that because, again, you saw the numbers of exposures that we had, and that really did help us. This led to a sharp drop in our personnel testing positive. In total, since this began, we've had 56 members of Boston EMS test positive for COVID-19. And however, since in the last 3 months, there's only been one person test positive since we've been able to take advantage of the vaccination process. Okay, next. One of the other things too that I think has really helped to keep our members safe and keep our numbers low relative, our numbers low relative to some of the other public safety agencies. Certainly our size is a little bit less, but considering our exposure and the fact that we're up front and close, sometimes doing some very invasive procedures with patients, a lot of things help us. Essential to protecting our personnel beyond PPE, testing and vaccinations. We built out an infection control team comprised of our Office of Medical Director, our clinicians. We contracted with an infectious disease physician, and we also brought in some temporary nurses as well. They were instrumental in ensuring that we had the most appropriate guidelines and minimizing spread of infection. Every member who was placed out on COVID-19 was screened by a member of the infection control team. They had routine well-being checks, with follow-up with phone calls at home, and if necessary, more than that. They were connected to necessary testing. Members who were out ill due to COVID-19 also received care packages or were offered them. Some people declined them, but if people needed extra masks for members at home, gloves, wipes, thermometers, Tylenol, Gatorade, snack, anything to help keep them at home if you had to like isolate yourself at home from the rest of your family members, or even in some cases try to help to relocate people. And we did get some offers for the city. Some people did move into temporary dormitories to protect other members at home. We took advantage of anything that was available there to try to do that. For the majority of the pandemic, we utilized a chatbot text, which sent out a daily reminder about 2 hours prior to the start of your shift. You would get a text quizzing you on symptoms. It was a yes or a no, it was simple. If it was a yes to anything, you would get a follow-up phone call from the infection control team. And if it was a no, it was a remind you to call if anything changed. Okay, the vaccination, I can report that 80% of our personnel have been vaccinated. 100% is a lot better number, and we're still working towards that. We've been working in partnership with the Boston Housing Authority, and you know, you can see like a total vaccinations. Our numbers have gone up since last week. We did a couple more, probably since this slide was done. We did one yesterday in South Boston, the second round one. We're in Charlestown. We've been going out to a lot of community sites. We've gone to some treatment programs to help out with that, with testing, and also with vaccination, trying to go where maybe some people have either difficulty getting out or they're reluctant to come out. We pale in comparison, of course, to them 7,000 a day that FEMA was doing at the Hines, but we're trying to go to where people live, to where we go to see them now. So instead of taking them to the hospital, we're trying to keep them out of the hospital. And we've had involvement in the Martin Luther King Towers, Hassan Apartments in Mattapan, Franklin Field Apartments, Charlestown Public Housing, South Boston, and Bowdoin Manor downtown. I'm trying to speed this up, sorry. Next ahead, looking ahead, personal recruitment and retention. As stated, our workforce is our #1 priority. We want to keep them we want to keep them healthy and safe, but we also want to keep them working here, right? So we want to try to retain them and work towards that development and provide access for and pathways for promotion. But we also we know we have to keep up with recruiting, which has been a challenge during the time of COVID. The way you do testing, the way you do recruiting, but everyone has stepped up to try to meet that challenge. As we look for the next fiscal year, our priorities do include, again, retaining and continuing to protect and advance their safety and wellness for our personnel. We are in the process of upgrading our ballistic vest. It has a suggested shelf life of 5 years. We just finished fitting everybody to replace all of it, as some of it has come up for expiration. And we do continue to train with the Boston Police when they work for going into situations under force protection where the Boston Police can at least control a room, an area, or a street where we could rapidly assess people and get them out under police coverage. Unfortunately, that's something that we all do have to be prepared for in this day and age. And we do joint training with Boston Police and Boston Fire on that to be able to access an area where we could go in, perform bleeding control, airway control, and quickly get persons out, being able to work in a high threat environment in the warm zone and conduct training. That's training that we did even prior to the bombings back in 2013. The training we did way back then with the Boston Police and the use of tourniquets paid dividends, and we've expanded that so that it's second nature and hopefully muscle memory for all of our EMTs. God forbid we ever have to use it here. We've also continued to update our respiratory testing for all of our personnel to replace our Scott face piece for our gas mask, which is the highest level of respiratory protection that we could use beyond the N95 in case we need it for certain situations. And for patient care, we plan to continue research partnerships, and we're piloting a new form of an artificial intelligence application that can be used up in dispatch to help us with early identification of cardiac arrest and call taking, and which would work in tandem with our operators as well. And for the community, we plan to reinvigorate our outreach and engagement efforts, which were impacted by social distancing restrictions during the pandemic, with one notable exception. Our car seat check and car seat installation for newborns, that was never curtailed. That took a lot of infection control procedures to continue with, but making sure that we could offer low cost and no cost car seats to new parents who needed it, or to make sure that their car seats who they had were installed properly, was a service we were able to do throughout the pandemic. And that's it. Thanks. Sorry I went on a bit long, but it's been a busy year.
Thank you, Chief Hooley. And I know it's going to Jen next. And I would just ask Jen, I know you've got another great set of slides. If you could just move through them expeditiously so we do get to questions and stuff, that'd be great.
Okay, and Rita, do I pass this back to you? You did, Tracy. Okay.
All set?
Excuse me, and I'm sorry. I am now going to introduce Jen Tracy from Mayor's Office of Recovery Services, Bureau of Recovery Services.
Thank you.
Okay. Good afternoon, councilors, Madam President. My name is Jen Tracy. I'm the Director of the Office of Recovery Services. I'm joined today with my colleague, Devin Larkin, Chief Martinez, Chief Hooley, Rita Neves, who you heard from earlier. For expediency, I will run through the slides, and Devin and I will both be here to answer questions at the end. We're grateful to be here with you all today. Since I was before you last year, we've worked hard to meet the needs of our most vulnerable. Next slide. Our mission is to advance equitable and comprehensive substance use recovery services, increasing access to care and filling critical gaps. We work really hard across city departments with community partners to create a citywide recovery strategy and reduce stigma. Next slide, please. We have to keep saying the slide. Whoop. We offer a full continuum of care from harm reduction to recovery supports, focusing on each step of the recovery continuum. Next slide. As you are aware, we are still very much in the midst of the opioid epidemic. In 2020, the United States had the highest rates of overdose deaths on record. That staggering incline was no different in Massachusetts and in the city of Boston. There were 2,035 confirmed opioid-related overdose deaths for the state and 245 for the city, representing about 12%. COVID-19 and the opioid epidemic disproportionately impacted communities of color. Notably, we saw a stark increase in Black male mortality in Massachusetts during 2020. Next slide. Fentanyl remains the key factor in overdose deaths, present in 92% of toxicology screens of the most recent state data. Stimulant use has been on the rise for several years. We've been seeing it on the street, and now we're seeing it in the data. Next slide, please. As we are all aware, COVID-19 has had a direct impact on our clients and our staff. We have remained open and operational throughout the entirety of the pandemic, making significant program modifications, including social distancing, expanded space, and other modifications, including delivering AHOPE harm reduction services to drug users completely outdoors and shifting all behavioral health outpatient services to telehealth. The Engagement Center reduced its inside space and expanded the outside space to promote social distancing and adhere to regulations as they were posted. The Engagement Center and its staff have been instrumental in assisting with COVID-19 screening, testing, hand washing, and social distancing to unhoused populations. We created the Comfort Station as an emergency response to the lack of public restroom access due to the COVID shutdown. I am pleased to say that AHOPE has returned back inside to the drop-in center in March of this year. The new Engagement Center building is due to open on time in the fall, and additional supports have been added to the Comfort Station while we transition to reopening and deal with the effects of the pandemic. We've implemented testing events and vaccine opportunities at all sites, teaming up with EMS at our Mattapan campus in September with weekly testing for clients and staff, and introducing opportunities with our local health centers at all sites, vaccinating over 500 clients in early recovery and at the Engagement Center with very low positivity rates as well. Next slide. These next few slides represent some of our metrics and indicate the volume and impact of the work at the city level as we continue to respond to the devastating toll of the drug epidemic. Next slide. Our Mattapan programs adapted to rigorous testing compliance, social distancing, and continue to serve 650 clients safely in early recovery. Next slide, please. As a response to COVID-19, we opened Comfort Station locations, responding to the public health need for hand washing stations and restrooms due to the closures of publicly accessed buildings and other sites. At the Comfort Station, we offer a range of public health services along with basic need amenities, such as HIV prevention and treatment, street-based HIV, Hep C, sexually transmitted infection testing and treatment, treatment for PrEP and PEP for HIV prevention on a daily basis, directly observed treatment for HIV, and syringe services, as well as overdose prevention, Narcan distribution on a daily basis, harm reduction education and counseling, emergency overdose response and transport to Boston Healthcare for the Homeless or hospital when appropriate, sedation monitoring in a safe and sheltered space. Also providing addiction treatment in the space, prescriptions of medications, buprenorphine for opioid use disorder, supported referrals to methadone maintenance, referral and transportation to detox, as well as acute medical issues, wound care, cold weather injuries, and other acute chronic medical illnesses. Next slide, please. We continue to focus on engagement and access to care. As I mentioned, PATH provides triage to treatment along with transportation. This past year, the program placed almost 4,000 people in treatment facilities all over the state. AHOPE was very busy during the pandemic, serving over 10,000 people, training 2,700 people in overdose prevention, saving lives with overdose reversals daily, all while doing this outside. The Engagement Center averaged about 72 people at any given time throughout the day. This fluctuates from a maximum capacity of about 100 to a minimum of 40 to 50 throughout the day. There's a clinic inside the Engagement Center run by Boston Healthcare for the Homeless, which provides much needed medical care to participants and saw over 7,000 visits. Throughout, next slide, please. Throughout FY21, we worked with community partners to maintain and expand harm reduction efforts and services throughout the city. We created a harm reduction toolkit to assist in the care and treatment of people who use drugs in Boston. This toolkit highlights the core elements of harm reduction while educating the reader on how to implement harm reduction into their life, both personally and professionally, and will be released in early FY22. Thanks to the City Council and the FY21 budget, we created and published the overnight low threshold practice guidance to inform shelter systems and community-based organizations on best practices for serving unhoused individuals with a substance use disorder. This guidance sets the stage for how to open a space that is more accessible for people with substance use disorder, as well as informs on ways in which current systems can adapt to be more accommodating and meet the needs of people with substance use disorder. Next slide, please. The city offers comprehensive syringe response. We have increased the way we collect improperly disposed syringes each and every year since the office has been open. The main ways we collect syringes are through drug users themselves, outreach, the mobile sharps team, neighborhood kiosks, and our newest intervention this year with the syringe redemption pilot, which incentivizes needle pickup with peers on a daily basis. We will be expanding the pilot in FY2022. Next slide, please. We distribute Narcan and information in several ways. So far in FY20, we have provided 208 overdose prevention trainings to 6,711 people and have given out almost 18,000 doses of Narcan. We do this through street outreach, mobile services, trainings, and we're grateful to EMS for their new Narcan Leave Behind program, allowing another opportunity to get Narcan into the community. Next slide, please. I think you may have heard about the post-overdose response team this morning from the Boston Fire Department. Our partnership to address fatal overdoses that continue to happen behind closed doors and in people's homes. The city's post-overdose response team is a partnership between the recovery services and first responders, the fire department, EMS, and Boston Police Department as well. The intervention provides outreach, Narcan, and connections to services following a non-fatal overdose that occurs in a residence. The team conducted 347 visits and engaged with 140 individuals and family members, distributing 172 Narcan and overdose prevention resources. Next slide, please. We have a youth prevention team as well here, because prevention is vital to the response to building capacity in substance use. And we build capacity across youth systems by focusing on youth engagement, comprehensive health education, and technical assistance and training. The youth prevention campaign, which we started last year in person right before COVID, we quickly moved to online, providing an opportunity last year to launch online services and supports for young people. You can see the data on the effort, and as well on our website. We're working across youth-based agencies to support positive coping skills with youth, and feel like this is a great way to do that. And we have translated it as well into 6 different languages. Next slide, please. Looking forward. Oh, I'm going fast. So looking forward, we are increasing housing opportunities. We're conducting meetings with shelter services and community-based organizations to discuss creating low-threshold housing for people with substance use disorder. We have successfully advocated with the State Department of Public Health for low-threshold housing, specifically targeted to unsheltered individuals in the Mascast neighborhood with substance use and at risk for HIV. Those dollars will also allow 2 new outreach coordinators with 2 community-based organizations that are dedicated to focusing on women and housing. We also have recently added a housing case manager to the Mascast Street Outreach team for the early morning shift. Looking forward, we will continue to enhance employment efforts for returning citizens. We have several projects underway, one of which had a graduation actually a couple of weeks ago, and we will do another round of services with our federal, state, and city partnership, providing supported employment and wraparound services to returning citizens with a restorative justice approach. We have secured funding to work with the community in Nubian Square to create an engagement team with the Office of Faith-Based Initiatives and a Nubian Planning group. We also are in the process of creating a small business owner resource guide. We are sitting on the Governor's Opioid Recovery and Remediation Fund Advisory Council, representing Boston in the Opioid Litigation Council. Next slide, please. So expanding harm reduction, another goal of ours. We will be piloting 1 new mobile site in a high need area based on 311 call data and the Mobile Sharps team. This will be operating in addition to our very successful New Market location, and that is the Community Syringe Redemption Program, which is in this year's budget as well. And we're always focused on workforce development opportunities, stable housing, and employment opportunities. Next slide, please. We just updated our website, so please check it out. Thank you. Happy to answer questions.
Great. Thank you all so much. Obviously, that was a bit longer than we usually look for in a presentation, but I do appreciate all of the work that it represents, and also the written answers that you sent over to our questions as well were very helpful. So we will now jump into Counselor questions and follow-up. I think that we'll go first to, looks like we're going first to Counselor Wu. Let me just, sorry, gotta let everybody get themselves back in. Why don't we Let me just check if Councillor Wu is here. Councillor Braden, do you want to go in the meantime?
Oh, certainly, Madam Chair. Thank you so much. I appreciate the length of the presentation to reflect the incredible work that all these departments have been doing this past year. It's phenomenal and mind-blowing what they've dealt with, and with such an incredible professionalism and commitment. And I really want to echo all of our thanks to the great work that has been done. I had a few questions, and I don't know, I seem to have misplaced the answers to the questions, but the question really always comes up in Alston Brighton about advanced life support, and whether the time that it is to respond to an advanced life support in the outer reaches of Alston Brighton, not the close, if it's Oak Square or Chestnut Hill, how long it is to respond to an advanced life support call out here. The other question was, in terms of the location of the ambulance station, I know we talked about this last year. Are there plans to relocate the station to a more central location? Are we still in discussions with St. Elizabeth's Hospital with regard to that? And let's see. Those are really the two big district related EMT questions. The other question really was with regard to ongoing surveillance of on testing. Are we still keeping an eye on? I know our numbers are gone down dramatically, and it's really impressive. But every now and then I hear of a case of COVID and a COVID fatality that sort of gives me pause to think, are we missing some people? But again, we can't catch everybody. But just in terms of ongoing surveillance and testing and contact tracing going forward, now that there's fewer numbers, are we able to continue contact tracing? And those are really all my questions. Thank you, Madam Chair.
Who from the team wants to take that?
Okay. Good afternoon, Council Braden. Okay, yeah, so quickly.
Good to see you. Sorry.
Right now, as you point out, there's two ambulances that are actually garaged or based in the Alston Brighton area. Ambulance 14 and ambulance 9, paramedic 16, advanced life support truck, which is a primary one up there, and then the secondary would probably be paramedic 5 is over in on the Jamaica Plain side. Paramedic 16 is down by Brookline Ave by Park Drive, down by the Beth Israel Hospital as well. In general, the way our advanced life support units are configured is we have about 80, a little bit more than in the 80-something percentile of our calls do wind up being transported and attended to by our BLS crews, which are actually pretty advanced. Don't let the B for the basic fool anybody. Our folks are very well prepared and well equipped for a lot of things. We use the dual response. We send the ALS and the BLS for a variety of type codes for the cardiac disorders, the cardiac arrest, and other more serious nature calls. The BLS typically being more neighborhood based, with the other ones more like in zones based around the city. Same way in Hyde Park, Dorchester, downtown, South Boston. They're all covered by like larger, more overlapping areas. the response time, it's not unusual for the BLS to arrive first, but not all the time. And so in that case, yes, like right now, most I would say in most cases in also Brighton, ambulance 9, ambulance 14 would probably arrive first at a situation. The average response time for priority 1 calls, the median response time for priority year to date in Brighton is 6.8 minutes, and that's to the arrival of the first unit, whether it's ALS or BLS right now. So it's pretty consistent with the citywide average. As far as the St. Well, so right now we have both trucks operate out of a garage that we have space that we lease from Harvard University down on McDonald Ave, which is off Western Ave, down behind the, oh God, I forget the name of the body shop down there, but not too far. But
Indian Auto Body, and that whole area is developed. It's going to be developed, so we're going to be looking for a new place for you in the next few years.
I was going to allude to that maybe, but right now, yes, we do have a lease there, and hopefully we get some sufficient notice. They were going to do that. Years ago, there was a 15 years ago, some master plan for Harvard's 20, 30-year plan for developing that whole side there. And I haven't seen any kind of update or what that would look like in recent years. I know back when the economy hit the skids back in, was it 2008, 2009, a lot of things kind of slowed down there, but then it seems to have started to pick back up again. But for right now, the other side up there is, thankfully, is a good size one for us. We've even run on occasions additional like a training unit out of there because there was sufficient size in there. Or we've run units out there, either extra truck out of there during a storm, or sometimes when they've had large festivals or other things out in Brighton. Plus we also stock some disaster equipment in there for in case there's a lot of our some of our additional PPE and some things for public health preparedness are also stored out at that site. We were in talks, had been in talks with St. Elizabeth's about developing, for them creating a 2-bay facility out on in their campus. That did come up several times when they were having community meetings about getting approval for a parking garage, I believe, a multi-story parking garage they were looking to build on their campus. And that was discussed as some of the potential community developments, community benefits for the residents of Brighton and Alston.
Yeah.
Was to be to build a station out there.
I hate to interrupt you. I think, Jim, well, we need to continue this offline, this conversation. I see the gavel, and I want to be respectful of my other colleagues, but I think we should continue this conversation offline. Thank you. Thank you for your testimony.
Thank you.
Thanks so much, Councillor Braden and Chief Hooley. Next up is Councillor Michelle Wu.
Thank you very much. Hello, everyone. It's great to see you, and I really appreciate you taking the time to give such a thoughtful, comprehensive presentation. I just wanted to get a little bit into details about the alternative crisis response pilot. We had heard just a bit with BPD in previous hearings about bits and pieces, but that it was really, they had mentioned that there was a steering committee or agencies that were involved and different department heads having conversations. So just curious if we could get a little more detail about even the planning of it, who was involved at the kind of department head level and any other details.
Sure. Thanks for the question, Councillor. So right now, in terms of the alternatives to the mental health response piece, it's a pilot planning process that's being led in partnership through the policy office and the mayor's office, Health and Human Services from my office, the Boston Police Department, Chief Hooley and his team through EMS, as well as our best clinicians, who I know you know are part of our co-response to some of the many issues that we face today. And then a variety of folks within all of our universes that are coming together. We're currently in a process where we have set out a charge to provide recommendations to the mayor for a pilot that we would implement starting in the fall. So we've been going through this planning process where we've been looking at national research around a variety of models from different cities that have not only been in place, some for years, but some that have come up within the last basically year or so as well. So we've been exploring obviously the entire sort of purview of that pilot in terms of the goal of decreasing police response where it's unnecessary, increasing the role of clinicians to ensure that we have the best possible response to those calls, to make sure that we're meeting the needs of the community. So what we're trying to do, and what we will have slated for within the next 4 weeks, proposed to give the mayor some recommendations on a couple different pilot options that exist to both strengthen the response in general, but also to not only pilot the initiative in the spring, but figure out what will it take to scale that. What will it look like to be able to figure out, what mechanisms we need to invest in? We're using the financial resources that are in the budget to pay for that scaling. To pay for that pilot. So it likely will mean additional resources to support, triage of calls at 911, could potentially mean additional clinicians on board. But we're working through this diligently to make sure that we are getting the best response, not just the desire is not just to eliminate police. The desire is to make sure we have the best possible response, and that's what we're working through now. So we would anticipate that we will have a pilot process recommended for the mayor within the next several weeks, and then we will begin a pilot actively in the fall.
So it sounds like there's going to be several options sort of laid out, and then just one chosen, or potentially testing out a few, or likely just one. And then what does it look like in terms of community engagement and being able to either shape any of the multiple that are presented or narrow down to the one before the actual implementation of the pilot?
Yes, a great question. So right now, those three pilot, the goal will have to be that there'll be several components of the pilot, right? Because there's also about visibility for current efforts that already exist. Sometimes we hear people describe ideas like we should have a co-response model, which I know we already have, right? So there are some things that we know we need to raise visibility of. So that's also part of any pilot effort. There's also the desire to make sure that training, which we know is a part of all this, is put into that process. So the goal likely will be a pilot with additional components related to it. The goal is to not only have options to provide to the mayor, but also we've already begun this process to engage community organizations, community groups, and other stakeholders that are not only interested in it, but folks with lived experience who either had an exchange or engagement where police who's responded, and maybe a clinician would have been a better response. So we've started that engagement with stakeholders so that stakeholders will be able to weigh in on the pilots before a pilot is chosen. We're gonna have that as part of the process. So we will both be making recommendations about pilots, this working group, but we will also have community voice part of that process to ensure that we're not only creating a pilot that we can sustain and use, but that it's actually shaped by the community and not just the working body that's doing the legwork.
And so I'd love to bring in Chief Hooley too, into just getting your early thoughts on this, because of course there's a choice of who will actually go and connect with residents who have put in the call for services. But then even in the receiving of the call, in the call center and the intake, the decision making of how to assign this and what the variations are, the training of the call center staff, how does that look like, and how does that fit into the multiple steps that will need to be done before the implementation of the pilot begins?
Okay, thank you, good afternoon, Council. I'll try to make that real quick on that. So that is all involved in what Chief Martinez was trying to outline. So some of it could be from the time how a call comes in, and does it come into 911? I mean, right now, that's what's available. People talk about other numbers, other different ways of doing it, but right now it exists with 911. What do we look at for the different numbers? How are those calls handled? Who's taking it? Is it the 911 operator? Is it an EMT that does EMD, such as we do? And if that's the case, what's the procedure for? Do we conference in somebody, say from BEST, who's can determine whether somebody who can make an appointment and take care of somebody separate versus a crisis, where is there violence? Is there something else going on at the scene? Does a family feel threatened? Or so part of it will be like how the call comes in. Then what's the best way to give it out? Like right now, we give out EDP2s, EDP3s, and without getting through all that, EDP3s the police don't go to now. So is there there's different response configurations already right now, but are there better ways to do that? Is there perhaps a different place where people could be transported? Now, again, we would have to make that would take some change with some regulation at the state, but everything's on the table right now as we look at some of these different models. But the idea is to all of us be at the table working on it so that our assumptions are based on what our partners can do and what they can't do and what we can do. So it's I know that wasn't a detailed answer, but the answer is that yeah, we are looking at a lot of the call screening, what training we have to do, and what training we have to do for because officers like now on the street encounter patients. Over almost 4,000 times last year, we were requested by the BPD to go to another call they were at. Could have been a motor vehicle accident, could have been anything, a disturbance call where they suspected maybe somebody was in need of a mental health assessment, and we would come and deliver them and take care of that. And so it's so they don't all come through 911. So there will be different models to look at. Yes.
So I think I'm sure I'm almost out of time. So I'll package my last two as just a comment, which is just to note that in the process that Councilor Mejia, Councilor Edwards, and I and our offices had started in terms of a conversation with community members about alternative 911 response and shifting things from public safety and law enforcement to public health focus. I think we wanted to even there's a strong demand just to have transparency and information about the starting point as well. It's been very hard to get 911 data on, what is it for and how was the response and this and that. And I would love to just make sure in this creating of the options, in the narrowing of the options that the public, that we're all starting from a same shared understanding of what that current situation looks like with calls and who's taking what and what they're for, et cetera. And then similarly, just in terms of how we are making choices between options so as to actually respond to where communities are feeling the need versus potentially designing a lot of things without people at the table. So that was the strongest feedback that we had received in the ongoing conversations that we've been having, is that in the steering committee process, in the agency heads, it would be great to have, and I think really important to have community members also embedded in those ongoing reviews and iterations. Thank you very much, Madam Chair.
Great, thank you so much, Councillor Wu, and agreed, I will be back on those themes in my questions. Next up is Councillor Mejia, and then it'll be Councillor Campbell. Councillor Mejia.
Hello, everyone. It's good to see you all. Thank you for the thorough presentation. I'm really encouraged by all the hard work you all are putting in. And I just kind of want to underscore Councillor Wu's point in regards to the importance of having a community-centered process and engagement as we continue to build that out, just because I do know that was definitely one of the things that we were pushing for. So I will continue to push for that. But I just kind of also wanted to continue on another point that Councilor Wu made. So I'm just curious, how are we activating, now that you've heard this, curious about how we're going to do so, thinking about the Muslim Justice League, the AARW, W, the YJPU, and others. Like when I think about this alternative to 911, I'm thinking about groups who have been at the table, and do you all have relationships with some of these groups, and will you be thinking about bringing them into the conversation?
Yeah, so thanks for that follow-up, Counselor. As I stated, the goal is to integrate community voices into the process. That the last meeting that Chief Hooley and I were just involved in, I think on Tuesday of this week, we had a pretty thorough conversation about ensuring that community organizations, community voices, not just folks that are connected to community groups, but also folks with lived experience who've had some of these experiences on the ground could weigh into this process and weigh into better understanding how these options might end up getting piloted. So obviously many folks that are at the table have relationships with a variety of community organizations. And so that is the goal. So it is not the intention to create these options without those voices. If you have specific organizations you'd like us to engage with, we're glad to do that.
Okay, so I just named a few, and we'll make sure we'll connect you all with them. And in regards to the Racism Free Boston RFI, your response said that the feedback from the community will inform both the Commission's operations as well as our broader policy agenda. And can you just talk a little bit about what that process will look like, and how will this feedback go from just feedback to actual policy change?
Hi, Councilor Mejia. Good to see you. So the RFI, it's an activity that falls under declaration work, as you mentioned, and it was our first attempt to, under the declaration, to continue to have community engagement, from the beginning. So we put out the RFI in 8 languages, and we had a good response from both residents and 23 organizations. And that helped actually inform some of the strategies that we're developing under the declaration. And we see this as just the beginning. This is part of our, we have a very strong community engagement component of the Commission, and we'll continue to create opportunities for us to lift the voices of our residents into the work we're doing around anti-racism and racial justice. So it helped also with some of our policy and practice, for example, strategies. We're doing a number of RFRs with community members. One of them has to do with increasing. We're doing a pilot around race, ethnicity, language, demographic data collection. And we contracted 11 organizations to help us develop and pilot and implement new ways to collect race and ethnicity fields that are representative of all the populations in Boston. So, and we're also doing a community-based translation pilot, also to increase capacity of our CBOs to do translation services. And it's to ensure that those voices, that we're not going to a company to do translations, but we have groups that are culturally competent around doing that kind of work. And also, it's economic development for those CBOs as well.
Thank you. I love that. And before my time goes up, I have 2 more questions that I want to try to get in, okay? I think in one of your responses to our questions, you mentioned that the Boston Public Health Commission is working to form a coalition to offer support behind an act to reduce racial inequities in maternal health in particular. Can you please provide an update on how that work is going, and who is being brought on to that coalition? And then one more question is, how will the new Director of Youth and Young Adult Homelessness Initiatives work with local organizations who are already plugged into the work of providing services to our area unhoused youth? I'm thinking particularly of Bagley and the Trans Youth Fund. And then my last question is, what does moving the Office of Returning Citizens do functionally to help our formerly incarcerated loved ones? That's a lot. So hopefully we can get through all of that. And it has to be really short answers.
You know, we have a maternal child health component, and under that, we've been doing work for many years around our led by our Healthy Start initiative and a Healthy Baby, Healthy Child programs, both programs that are, you know, like 20 years plus. So we have been working with other providers to continue to implement strategies to look at, you know, maternal child health disparities around maternity, around, you know, maternal mortality. So we just passed the bill. We're getting ready to get a group going so we can continue to implement, you know, some of the strategies that the bill it's allowing us to put forward. So this is just, you know, ongoing continuation to an ongoing work that we have. And looking at disparities, you know, in how to fill the gaps with the right people at the table.
So briefly to the other two questions that you asked, Counselor, the youth and young adult homelessness position isn't new. It's new, formalized in the budget, but that's a position that Roxanne Longoria in our office has been in for about 1.5 years now. So we've been a partner with D&D on the Rise to the Challenge Ending Youth Homelessness Plan, and have been working on youth homelessness very specifically with organizations, including Bagley, including Glass, including Bridge Over Troubled Waters, More Than Words. So we have extensive relationships with these organizations and are tied into them in an overall plan that the city created with a variety of strategies to truly address some of the issues around youth homelessness, specifically for LGBT youth and youth of color. So we will continue that work, but it's been formalized, which is why it looks new in the budget. And then we moved the Office of Public Safety this year. Again, it's more formalization, including the Office of Returning Citizens. Both of that, the work of both of those offices is really a public health, is taken from a public health lens. So this will give us the ability to be able to ensure that the outreach, the case management, the referrals, that all of that is really done from a public health perspective. We've started that work in partnership with the Public Safety Office as well as the Returning Citizens Office, and we'll continue that.
And before I get the gavel, I just kind of want to name that as we start thinking about COVID and reopening and recovery and all that good stuff, is that, you know, the impact, the social and emotional and traumatic impact of our residents will need to continue to be front and center of all things in our Boston public schools, our city employees. So I think that you all are well positioned to really lean into the trauma because the impact, I think, is going to be lingering. And I also think that the financial burden that a lot of families are facing now will also lead to traumatic responses and support. So I just kind of want to just put that on the, I mean, you already are thinking about it, but I just think that I'm hearing a lot from folks who are experiencing a lot of trauma as a result of COVID. And I think it's just something for us to just continue to keep on the forefront. And I do appreciate all of your hard work. And I'm grateful for the opportunity to ask questions. And I see the gavel. Councilor Bach.
Thank you so much, Councilor Mejia. Councilor Campbell, and then it'll be Councilor Flynn.
Thank you, Madam Chair, and thank you for that very long presentation. It was long, it was thorough, and I appreciate that. The only challenge is I won't be able to stick around for 3 rounds of questions, but I know you guys all have incredible, really hard work. You got a pandemic, public health crisis with the opioid crisis, public safety crises, and then just taking care of yourselves and your team. So thank you all for the work you have been doing during COVID, of course, right now in the midst of COVID, even with light at the end of the tunnel. Appreciate each and every one of you. And I will re-up this, Councilor Bach, through you as the chair. I know I made this request early on, you know, what the budget asks were for the departments and what they actually got. And I'm always asking that question. Usually I ask it to Jen Tracy. I remember at a budget hearing, I was like, how much money do you need and how much are we giving you? So I want to re-up that request for departments because I think it's important to know what departments are asking for and what they're actually getting to be able to respond to task at hand. The only questions I really want is just to talk about what's happening at Mass and Cass. You know, a group of us, of course, we're just at Suffolk County House of Correction. We are getting calls all the time from residents. I'm sure you are too, emails I refer to as Mass and Cast because that's where it's on full display, recognizing it's showing up, of course, in every part of the city, downtown neighborhoods, near the TD Garden, in more concentrated ways, different ways. But we're seeing more tents come up. It's no longer just a public health crisis. It is also layered. There are layers of a public safety crisis in the area. Folks coming, at night. I've been using different examples. These are real stories, right? Of people just showing up, fancy cars. Let me get rid of my supply in an hour and then get in my nice fancy car and drive off. So how are we responding in the immediate? What are the short-term solutions? I've sent a letter and some other ideas to the administration that come from various stakeholders as a way to engage us all. And I did stress to IGR, I'd love a follow-up to that. But what are we doing in the short term, the long term, to respond where people can see and feel that response? And also, how are we pushing the state to do their part too, which of course is a major part of this as well?
So there's a variety of members of the team. Thank you for that question, Counselor. A variety of members of the team will want to weigh in. What I can say overarching is that obviously the city has been, working the issues around the substance use disorder crisis that we see, a crisis that almost every major city in the United States has in one way or another. And it's a crisis that COVID did exacerbate. And make worse. It did not create it. Obviously, it was here before COVID, but it did make it worse. And so I think what we've been trying to do over the past year and a half, if you will, has been to really ensure that we continue a three-pronged approach. We continue that focusing on getting folks access to the treatment, care, and support they need. And you heard a lot of that from Jen Tracy around the public health and all the work that they've done in recovery services. We've also been focused on public safety and tackling the uptick in crime that we've seen. We're currently in a downturn where we've seen a decrease in crime in that area, but we saw an uptick. We saw more people coming in, preying on folks needing help and support. And so that public safety challenge has been a continued focus. And then the quality of life piece that you mentioned related to obviously cleanliness, tents, needles, all the things that have made it worse in the neighborhood itself. Those three pieces continue to be the three-pronged approach that is in the plan that we released in October of 2019. And that plan is literally in the process right now of sort of being torn apart. What's working, what isn't working, what are the long-term strategies we need to strengthen, what are the things that didn't happen that need to happen. COVID presented a perfect storm, if you will. It closed a variety of services. It brought more people from outside of the neighborhood into the area. I would argue we have double the number of people in the streets in this immediate area than we had at this time last year. And again, the data from the state showed us that we see more fatal overdoses in the city and in the state, especially amongst Black men and people of color. And so what we've tried to do is contain and continue all the strategies that have been in place, but recognize the fact that more work needs to be done and that we need to ensure that we're not looking for just a quick silver bullet, because there isn't one. It's a complexity of issues down here that many folks are trying to work through and trying to make sure that we're actually moving things forward in terms of both long-term strategies, but short-term. I'll give you a couple quick short-term strategies that I'll mention to you. One has been to strengthen our ongoing coordination. We continue to have daily calls, the Boston Police Department, Public Works, Parks, Recovery Services, EMS, Public Health, to look at the day-to-day issues that are in the neighborhood, ensuring that we're tackling those on a consistent basis. We continue to have weekly coordination calls where we're looking at the data that shows us who's getting into care and treatment, who is still rapidly in need of housing and support, and how do we address the fact that there are still programs in other cities and towns outside of Boston that are closed, that are not taking taking people, that are not serving the needs of their residents. And that is then coming down on the city of Boston. So the coordination piece, we're strengthening that and have lifted that up even more so to make sure that we can continue that ongoing work. We've also really worked with the police department over the past several weeks to really better understand their strategy around trying to tackle drug dealing in the neighborhood. There's no question, to your point, Counselor, there are people preying on those who are at some of their toughest moments of their life. And so we've also started working to ensure that that coordination is tighter, that we understand the work of the drug unit on the ground, and that we understand how we're doing everything we can to take folks off the street who are not there because they're in need, but who are there to take advantage of those folks who need it the most. And the last strategy I'll give you in the short term is the work not only through our Homeless Bureau, but D&D and recovery services, is we know a pathway to getting off the street is not only about care and treatment, but it's also about short-term and supportive housing. And so trying to figure out how very specifically we are looking at a target list of who's on the street, who's able and ready to get housed, how do we create that pathway for folks, and how do we do what we need to do to not only get folks into those places, but to reduce the harm that folks are experiencing as they're trying to get on that pathway. There's lots of long-term pieces related to that, but the short-term work that's happening is really intended to try to reduce some of the immediate issues that people are experiencing.
I wanted to make sure that I was very much intently listening, but I'm going to stress this, Chief Martinez, and I know everyone is working hard. When I was working with a whole host of folks, calling ferry companies, putting in the work to figure out how we could have short-term solutions that would have a greater impact, that people could see and feel. Because right now, what people are seeing and feeling is that the situation is getting worse, not better. We hear that from residents. We heard it from Sheriff Tompkins, business community. A whole host of folks are saying it's not getting better, it is getting worse. And there's much fear around, as the summer weather gets better and we enter the summer months, that it's only going to get worse, and that the public safety component of people getting stabbed and killed will also get worse. And so I know there have been several versions of the plan and a push to do better with respect to coordination, public safety. I'm going to continue to push the points that I sent in a letter and email, which is, I do think we need someone to own just this. I know you're owning a whole bunch of things. Everybody's owning a whole bunch of things. Someone whose job it is just to focus on this, to coordinate not just the departments internally, but all the external stakeholders who want to play a role, members of the task force. Councillor Flynn, I see your face is right here. He's on the task force as well. It just still feels very disjointed. And so not only having someone own this issue from the city side who is just focused on this and pushing, frankly, if someone has some recovery experience, whatever it is, but just this, to then coordinate all of these players at the same time. And I do think that coordination piece is critical. And I know some of it is happening, there's areas to improve, but it really does feel like, you know, with an area that has so many different jurisdictions, so many different players, different folks, frankly, showing up at different times to respond, including community members who are showing up to drop off food. How do we coordinate everyone to be a part of this? How do we coordinate the same players? That's another thing too. We have different folks showing up. And so there are great ideas on the table. And I know I'm pushing for a meeting with residents, stakeholders, and the acting mayor as well on these things. But I can't stress enough that when we go back, not just me, my team, to engage with folks about mass and CAS, no one is saying that it is getting better. Everyone is saying it is getting worse. And it's painful because we want to be able to respond in such a way that not only hears that, acknowledges it, but then, of course, improves it. So I do think there's some ideas that we could be implementing. I see the gavel waving. I hear you, Councillor Bach, but I can't stress this enough. This is the issue that keeps me up trying to figure out how to do better. I know it keeps up everyone on this Zoom, but I do think we need someone to own this issue. That responder unit idea, I think it could just be better, frankly, than what we currently have. So continuing to want to work in partnership with you, the administration, and everyone on this Zoom and everybody else in terms of response. But it is, these are the emails and painful calls that I know we're all getting, but just want greater action on some of the ideas that are being proposed. I see the gavel, Councilor.
Yeah. So, Counselor, I know that you're ready to move on, Counselor Bach, but if I could just very briefly, Counselor Campbell went over a bunch of stuff there that I think would be helpful. The only brief thing I'd like to mention, Counselor, is that I know you mentioned this, and I know you know this, but pretty much everyone on this call has been dealing with this issue for years, right? Yes. Actively in their role, actively in their work, to try to figure out how those solutions that for some of those solutions now seem new to folks, but they're not new. Many of the solutions that people are throwing out are sort of, combinations of things that we are already doing. I think what I want to make sure people hear, the public, is that the city, the administration, we absolutely agree that things have gotten worse. We absolutely agree that there is more attention that is needed. But I think the pushback is that the folks on the city are working in a coordinated, intentional way to try to be real about where things are working, but also to strengthen the areas that are not working.
I understand, and
I think that
the only reason I'm stressing this is because we had the meeting for 2 hours. So I've been on for 2 hours waiting to talk about this, and I see a gavel. And thank you, respectfully, Councilor Bach. And I agree with you. I never want to suggest that anyone on this Zoom or any department right now is not working hard, and hasn't been. City departments, of course, and those external, you got folks from BMC, a whole bunch of stakeholders have been working really hard. And I've been stressing that. What I got from all of these conversations of really listening and talking to folks about what is working is that people are overwhelmed, that people are trying to figure out what works best, and that it is incumbent upon the city, of course, to exercise that leadership to coordinate everyone. And so some of the ideas I think are new in that they bring together what has been operating in silos at times in a more coordinated way. I've talked to task force members, other folks in city departments, external, who say, yeah, we need to do better. And on the someone just owning this issue, I'm going to keep stressing that because everyone on the Zoom is owning a lot of issues. Who's owning mass and CAS? And as I see more tents and other things develop, that is, I think, one idea that is critical, given all that you guys have going on. So I want to be respectful of my tone, but also just stress the fact that I do think there are some new ideas that are coming out of new conversations on what's working, what isn't. And that was my goal, not to just throw out some random stuff, but to really try to connect with folks in a meaningful, thoughtful way, to put forth ideas that might make a difference. And so wanting to try to push for implementation of those, along with, of course, hearing from the administration what is also working. So I will keep and stay in touch with you guys. Thank you. Thank you, Councilor Bach, for the discretion. Thank you, guys.
Thank you, Councilor Campbell. Councilor Flynn.
Thank you, Councilor Bach, and thank you to the health professionals in the city of Boston that are on this call for the work that you've done over the last several years, especially over the last year during this pandemic. I wanted to make I have two questions in one point. First of all, I'll go right to Chief Hooley. Chief Hooley, one of my priorities, as you know, we've talked about this many times, because of the population growth in the South Boston waterfront, we desperately need a ambulance EMS presence in the South Boston waterfront or Fort Point neighborhood. I've talked to the mayor's office about this. Just wanted to ask for your support for an EMS presence in the South Boston waterfront.
Yes, Councilor Flynn, thank you. And thank you for that and for your support. And of course, we support that. And I'm happy to say that, there is still a couple of years ago, the city, you approved in the capital budget, I think there's $375 in there for siting and design, which is the important first steps. BPDA, property management, city, they're looking at different partners down there. They did seriously consider a smaller parcel on Dry Dock Ave last year. They looked at it a few different ways. They looked at building up, whatever, and they in the end, they determined that it was just too small for even a single bay, let alone like a two bay. I know they were exploring some other city-owned property down there, so I know it's still very much on the table, and I'm encouraged with that. That it hasn't fallen off. So that's all I can really say for right now. But they very much tell me that they are still active and committed to that.
Thank you, Chief, and thank you for your exceptional leadership in this city. We appreciate it. You've been very responsive and dedicated to the residents of the city. I have one comment, and then I'll go to a quick question. I worked closely with Chief Martinez. Chief Martinez and myself, we organized the first COVID-19 meeting, maybe in the country. We had it at the Josiah Quincy School. We talked about, obviously, COVID-19, but we also talked about anti-Asian racism and bullying, intimidation. So, Chief, as we go forward, first of all, I want to say thank you for your leadership, Chief Martinez. Certainly, COVID-19 hit the communities of color very hard, including the Asian community. And we defined racism as a public health challenge issue, emergency. What are our steps in terms of working closely with the Asian community going forward on public health issues? And again, I've worked with you very closely on these issues the last 3 years, so thank you, Chief.
So thank you, Councilor Flynn, and before I ask either Rita or I also see Margaret on here, because the Commission's been doing some real specific work to engage diverse communities, specifically also the Asian community around the vaccine, et cetera. But I think it's been important. I mean, no question from the very initial days of COVID impacting our communities to the challenges we've seen, what we've really tried to do is make sure we don't lose sight of not only the disproportionate impact that's been in certain communities, but also when we saw the impact of anti-Asian hate crimes that also rose up, that I know you played a key role in. And that's been a central part of a conversation we've had with our Health and Equities Task Force. That task force has brought in a variety of perspectives. We have obviously some strong, Asian leaders in the task force from the community who have played an important role. Karen Chen, Suzanne Lee, Dr. Watanabe from West Boston, and others who've really pressed the city and pressed the task force to do a variety of things and continue to engage not only in testing and vaccine and all the public health strategies, but also the engagement of the Asian community, whether it's in Chinatown or in Dorchester or in Austin Brighton and in different neighborhoods. And so the city's going to continue to do that work. We welcome, your involvement as you continue to be a leader to press that case, and we want to continue to be responsive to it. So that's what we're going to do in partnership with the task force. But again, we have some current efforts in way to try to make sure that we can raise awareness around the vaccine, raise awareness around still the risks of COVID. So I don't know if Rita or Margaret, or if you wanted to just share a little bit about some of that we've done specifically within the Asian community. I think that would be important to share as well.
I think the work we've done around vaccine education and access has given us the opportunity to expand the work we're doing with all different groups in the city, but particularly our Asian community. And as you mentioned, we did the first meeting in the city around this issue, and after that we've done others that we've been able to participate. And I think we need to continue to do more of that as we continue to promote vaccine access, and as we continue to increase awareness that COVID is not over, and that people need to know how to continue to access testing and services, and also how to access other services around housing, jobs, healthcare, and all that stuff. So I think, we have a good connection with different groups that serve the Asian community, and need to continue to expand on that and strengthen those relationships. Margaret, I don't know if you want to add anything. Margaret Reed, our interim Chief of Staff, is on the Zoom as well.
Good afternoon. Thank you. I'll just take 1 second and thank you, Councilor Flynn, for that question. I think one of the things we've really been excited about, Rita had mentioned the request for information earlier, and one of the things that came through from community residents loud and clear was better data, stratified data. And certainly that's something I believe you've been working on with Chinatown organizations for quite a while. And as Rita mentioned, some of the pilots we're doing from the declaration are about putting money into the community with local community-based organizations to be paying them to do translation and interpretation instead of sending money far away, and to use our local knowledge, and also working with local community organizations around this data collection pilot, and also our Boston Health Equity Measures data set. And then the one other quickly really exciting, you know, it's hard to say anything coming out of COVID has been exciting, but one thing we've been able to do is work with the Mayor's Office of Immigrant Advancement around creating a multilingual speakers bureau of immigrant clinicians. So we have been doing presentations using community representatives who are volunteers and supporting them. We've been and doing this with Moya. We did one just this week in Vietnamese. And between Facebook and Zoom participation, there's already been well more than 200 people, I believe, that were either participating or able to view. With Moya, we were able to do a similar one in Cantonese and Mandarin. So this is, you know, this is a model that should become a post-pandemic model. It should stick with us, right? So those are just some examples of, you know, work that I feel like we're, you know, really exciting work that we're able to do.
Thank you, Margaret, and thank you, Rita, and I see Jerry there. I see Grace. I see Jen Tracy as well. I guess my final, I don't have a question or a comment, but let me, a question, I guess you can answer it maybe offline, Chief Martinez. Over the last year, I've been meeting with experts on medical professionals on HIV and AIDS. I've talked to professionals at East Boston Health Center, South End Community Health Center, Fenway Community Health Center. Just want to continue to work with your office on, you know, services, programs, medical care, outreach for persons living with HIV and AIDS. And I'm going to take a look at the budget again to see what's in there, what type of programs there are in there. But that's a critical issue going forward. And it's probably not to put any blame on anybody, but I think the cases, as we mentioned, are on the rise in the city and the county as well. But it's a critical issue and a critical public health, and just want to see if we can continue working on that issue going forward.
We'd be glad to integrate Councillor Flynn into some of that. The team, there has been an uptick in HIV infections, and the team is actively working on it. So offline, we can give you more information and connect you to it. So I appreciate you lifting that up.
Thank you, Chief, and thank you to the medical professionals here from the City of Boston Public Health, doing an outstanding job. Thank you.
Thank you, Councillor Flynn.
Thank you, Councillor.
Councillor Edwards.
Thank you very much. I'm going to echo everyone else's thanks to every single one of you, Chief Martinez, Chief Hooley, Jennifer, Jerry, Rita, Margaret, Grace. Am I missing someone who testified? I have to thank you each individually. I have seen your work on a daily basis throughout my district. I want to, you know, Chief Martinez, you and I had I thought it was an excellent conversation when we were discussing the vaccine equity ordinance, as you recall. And you know, what had happened was, what I understood was the ordinance came out, and then a lot of what happened in the state changed. And then the Black COVID response team came and just blew it up. And I mean, in a great way. In a great way. And so, and your numbers, when you gave the statistics, I think it was Rita who gave the statistics on the COVID vaccination rate in Boston, I'm so encouraged by the work that you have done. And I've personally gone out to the vaccination clinics in East Boston to hear the bachata music, to hear the aggressive outreach. And it made me emotional. I was so happy. I was so happy because East Boston had been on the other end, as you know, with this crisis. And we have been through a lot, as you know. Our sisters, our brothers and sisters in Chelsea, right next to us too. You know, we have a shared community, I feel, in history and ethnicity. And so to see what those clinics are doing, the pop-up clinics, that kind of creativity and meeting people where they are, like right by the Marshalls in East Boston, let's pull the truck up and do it. And I just, it makes my heart incredibly grateful to your work. I know you've had a lot of sleepless nights. I know that you have done an incredible amount of work. I wanted to talk a little bit about the Office of Recovery Services and honestly ask, do you have the resources that you need? We know overdoses went up during this pandemic due to isolation, due to factors that we could not control, but that add to the, anxiety, the mental health issues of people who are in a very precarious position, those who are in early recovery, right? Who are trying to get better. And do you feel that with the amount of increase in overdoses, did your budget increase too to help to meet that and to meet that need? I ask that because you're probably going to say there's no budget increase that's ever going to be able to absolutely meet that need. But I just want to know if you have those resources. I'm just going to rattle off my questions, Councilor Bach, so that I understand everyone's been on here for like 3 hours. So Office of Recovery Services, budget need, meeting the overdose increases. I really don't have any questions for the vaccination. I just wanted to compliment you. Also, let you know about in Charlestown, Tufts Center in the North End, and MGH in Charlestown again, thank you. And then with Chief Hooley, just talk to me a little bit about the diversity and recruits. Thank you so much for the acknowledgement of the moment that we're in and the call to reckoning, I think you called it when you spoke. That meant something, and I appreciate that. Talk to me about pipeline and diversity for EMS. That's really it. I know you guys are busy and I want to get back to your work, but those are my questions. Thank you very much.
Thank you, Councilor. So I will take the first question around resources. I will say our City of Boston budget has increased 233% since the office opened. And at this point in time, as you know, I mentioned we're opening it, the Engagement Center is opening. In the fall, we'll be moving into that. Our efforts are going to be very focused. We're coming off of COVID. And at the same time, the federal and state dollars happen to be coming in a different way than they had in the past. And so we're really looking to those resources less to fulfill some of the gaps and sort of create these new partnerships that we worked last year so hard on with our state partners and state-funded agencies to try to coordinate the efforts more. So that, I would say our focus is on those dollars that are coming down. We have opioid litigation settlement dollars that will be coming down in the next year, as well as federal and state dollars.
Thank you. And I look forward, if there's any way, if you're ever going to go district by district and set up any more, I would love to work with your office about what that would look like. Thank you.
Chief, I think, yeah.
Okay. Okay. Thank you. Sorry, I was looking for a mute button. Thank you. Good afternoon, Councilor. It's good to see you. Yeah, as far as trying to develop the pipeline, trying to keep it going, we've, a couple of years ago, we could give an exam and have 300 people come in to take the exam. People already certified as EMTs looking to work here. That has certainly decreased over recent years. For whatever reason, but I'm hearing that in different parts of the state as well. Even people who are looking to work for private, so we're competing for personnel. However, they're here. They're in Boston. We have residents. We have young people from our communities. We have people from, some of the success that we've had the last couple of years is we've been able to recruit people who are native Cape Verdean speakers, native Cape, raised at home, speaking Haitian Creole, certainly people who speak Spanish, either from Central America or Puerto Rico. And one of our hopes is that's going to inspire other people who look like them, who grew up in similar neighborhoods, to want to do the same thing. So we're trying to do that. Again, City Academy, the Office of Workforce Development, has been helpful for us to help to encourage that. Right now, they're recruiting people for the next program, which we're scheduled to start the next EMT class in August, and even just some help getting the word out on that would be good. Would be helpful. We've that's
May I ask specifically what that means?
We have Somali speakers in our class right now. We've second one up, and so that's all helpful.
Chief?
Oh, good.
Yeah. I just want to go on that particular point. You said you're starting a new EMT class and you'd like some help recruiting. Does that mean like a flyer goes out and we just tell people, eligible candidates, to do that, or how does that work?
Yes, certainly. So the one was with the City Academy, Office of Workforce Development, where we have classes coming up, and we're trying to reach out specifically to Boston people who qualify for this. And it's a lot of it is online, but we can push that out to all of you. It's on the city website right now. OWD, Office of Workforce Development, City Academy, and there's a page in there for EMS. We can in that we can certainly circulate it there. I mean, we have to get back to you all with information after this anyway, but I can make it a priority to get this to you in advance. We would appreciate that help with that. The second thing is we're trying to get that interest in even younger people before they even hit that age. Some of the folks from our Infinity Group are talking about trying to partner with Madison Park High School, trying to partner with other schools. We're trying to work with Bunker Hill Community College, to places that run EMT classes. We can go in and just try to start recruiting from the before they even get to that stage. Because the people who come in and take our class here, for us, we get to see them for about 6 months before, and we can really that helps to facilitate that. But in the short run, that's probably been the best most direct pipeline for us.
Thank you. That's it for me. Like I said, I'm just really proud of the work you guys are doing. Thank you. Thank you.
Thank you so much, Councillor Edwards. Next up is Councillor Flaherty, and then Councillor Asabi-George. Councillor Flaherty.
Thank you, Madam Chair. Obviously, thanks for the time and talents of all our public health officials. Really want to give a special mention to Chief Martinez, particularly throughout the entire pandemic, how accessible he and his staff and team have been. As you recall, Madam Chair and my colleagues, obviously, we were getting daily briefings, and it was a true partnership with Chief Martinez, obviously former Mayor Walsh and his team, to get us through this pandemic. But I can't say enough about his dedication and time and attention to the pandemic. Can't even imagine what his days were like. Clearly hasn't had a vacation in a long time. So hopefully Chief Martinez will be able to get some opportunity to decompress and take some time for your own sanity. But nonetheless, I just want to say thank you, and my staff wants to say thank you for the great work that you have done, along with your team. Obviously, you had a great supporting cast, and many of whom were on this call. So I just want to mention that from the get-go. Quickly, I just want to get an update on the Child, Adolescent, and Family Health Bureau Division of Violence Prevention. Are there any plans to hire any additional staff in this department to build capacity as it pertains to our neighborhood trauma teams? And I imagine it's been extremely challenging to identify instances of child abuse and/or mistreatment due to COVID-19 pandemic, and particularly with the stay-at-home orders. And I'm concerned about those cases and the fact that we haven't been able to identify them due to sort of less time with mandated reporters. So I want to make sure we're paying attention to detail on that one, as well as reaching out to the different nonprofits, whether it's our local community health centers and or some of our schools, with respect to those that have seen those situations and or are encountering them now as we start to reopen. So I want to get an update on that. I do want to know to Chief Hooley, this time last year, we were obviously talking about response times. Given the pandemic, that's obviously been put on the back burner because there hasn't really been any traffic. Starting to see some traffic now as we're reopening, but we were dealing with some response times issues with respect to EMS being able to get to the 911 calls and the victims in a prompt, appropriate time. And I know we were dealing with that. And of course, the pandemic hit, so that gets put on the back burner. As we start to reopen and as we start to get more traffic again, and as things start to get back to normal, that clearly will then sort of rise to the forefront again. So what, if any, steps have been taken throughout the pandemic or even now to address the EMS response times, and whether or not we're strategically putting on additional buses and or where we're housing them? And I'll concur with Council Flynn as the South Boston waterfront continues to flourish down there, and more buildings are coming, more residents, more companies, more employees. We obviously want to make sure that we're not taxing, other supporting units as well. And then to folks, obviously, Jen Tracy, obviously Director of Mayor's Office of Recovery Services, and for the work that is being done over at Massancast. I would like to get an idea, at least a snapshot of what's, based on the latest census, how many folks are over there on a daily basis? 2, where are they from? 3, are we reaching out to their respective communities, to their mayors and to their city councilors in an effort to help us? This is a regional problem that deserves a regional response, and it can't continue to just fall on Boston. I would argue that probably 2/3 of those individuals are not even from Boston. And then lastly, who is actually getting recovery over there? Because it doesn't look like there's a lot of recovery happening. Clearly, there's lots of services over there. But as to those that are continuing to sort of congregate at Massancast, I'm not quite sure what our success rate is and whether or not that's even working. Maybe an idea is to decentralize the services, call upon some of our suburban counterparts to step up and sort of take some of their children, their residents, and provide treatment and recovery and more beds in their respective communities to help us with the situation until they get called out for their lack of attention to this issue. We're going to continue to sort of just chase our tail. So I'm frustrated like everyone else. I know that you, obviously, in your team are doing great work, and will continue to do so under the leadership of Chief Martinez and his team. But the time has come, I think, to start to do an honest assessment as to how many people are there, where are they from, and actually who is actually getting recovery, and or is it just turning into something else? And if that's the case, then let's talk about decentralizing and breaking it up so that we can actually get to the core of getting people healthy again. So that's it in a snapshot. Madam Chair, I appreciate everyone's attention to detail. I'll listen carefully for the responses from Chief Martinez and from Chief Hooley and from Jen Tracy. Thank you, everyone, for your time and attention and for the great work that you guys continue to do on behalf of our city.
So, Rita, I think there was questions related to the CAP Bureau and trauma team, if you want to take those.
Sure. So quickly, thank you for your questions, Councilor Flaherty. We are overall CAF Bureau received $1 million last summer to allow us to increase our capacity to do the trauma work and violence prevention work we do. So the money, the way it's being distributed and what it allowed us to do was to increase the contracts for all of our community partners and neighborhood trauma teams so they can increase their capacity to do additional work. And then we also got money to add one additional neighborhood trauma team. An RFP was put out about 2 months ago, and we're in the process of wrapping up the process and issuing a new contract. So we'll end up having an additional team that will help us, continue to respond in different areas of the city. So we've been able to increase our capacity right on time for the summer months. Chief Hooley, you want to go next? And then Jen?
Okay, quick. Good afternoon, Council Flaherty. Thank you. We, as I mentioned before, yeah, you were right. Back, well, in the early days of COVID, traffic was non-existent, right? But for the last several months, we've been starting to see it pick up, and it's almost back to normal. And also with more openings and hours getting later for businesses, we do expect the number of calls to go up again. As you know, I said earlier, we base complement, our minimum complement on days and evenings was 26 ambulances. With COVID, we did increase that pretty much on a regular basis by 2 to increase that up to 28. And then obviously if we have special events, special weather conditions, storms or anything else, we also attempt to even fill beyond that. And that's typically on days and evenings, but we'll also try to augment by staffing additional ambulances on the overnight, looking at the data, looking at what we're seeing for call volume. We can predict on a hot day that call volume is going to go up as well too. We are pretty much reliant on overtime for that because our minimums are pretty high. So to be able to to mandate to keep people, but we do attempt and will continue to attempt to staff extra ambulances as call volume demands. So we do watch how we do per shift on that, try to tailor it.
So thank you, Council Flaherty. I understand the frustration of what people see down in the Mascas neighborhood for sure. And it is hard to see when people do get into recovery. We work every day with our treatment providers across the state in sort of managing the care of hundreds, up to hundreds of people down there every day. So people do get into recovery, but obviously not enough. I think the challenges of people's trauma histories and the challenges down in the neighborhood really take a coordinated effort with multiple departments and programs. And we've worked really hard in the past year to focus on treatment, but also housing. I think, from my slides, you'll see we've really increased our efforts around housing first and have found that is, a huge incentive for folks. So coupling housing first with medication for opiate use disorder, and then getting people stabilized enough to think about the next step has been really, has been successful. Working with our shelter system and our other housing providers. So I would say that's something that we are doing better today as a part of what we went through this past year in COVID than I would say we were doing 2 years ago. There are a lot of folks from a lot of different places. We have our core chronic Mascas folks, and we also have a lot of transitional people, as you know, and I think, that's what gets complicated is sort of the influx of people, particularly during this past year because of the shutdown and because of the changes in everything. So I do feel like we're turning a corner as far as the coordination, with partners outside of Boston, with our state partners around funding. We have very intentional conversations with them about supporting cities and towns outside of Boston to build up their capacity. We provide our expertise and provide technical assistance to some of the smaller cities and towns on how to kind of replicate some of what we're doing, perhaps at a little bit of a smaller scale, but in their community. So yes, those are ongoing efforts. So thank you for those questions and your support.
Thank you, Jen, and obviously thank you to Rita and Chief. I appreciate your work and I continue to look forward to working with you guys in partnership as a member of the council.
Great. Thank you so much, Councillor Flaherty. Councillor Asabi George.
Oh, Thank you very much, Madam Chair, and I apologize for not being on camera. I'm not in a sort of a great spot to do that. And I appreciate everyone who's here today and the length of presentation and discussion on some of the most important topics that we're dealing with as a city. I know that earlier in the hearing, a colleague asked, I forget who, about the new pilot program that Chief Martinez referenced earlier today. So I await the presentation on that hopefully very soon. I would love to ask about or hear about the role of Squad 80 in that pilot, but maybe the role of Squad 80 today. Just before COVID hit, I had the opportunity to spend some time with some members of Squad 80 and have continued to be engaged with them in their work. I think that they need a real investment, and we need to make sure that they are properly utilized, both to respond to the challenges at Mass and Cass and respond to the needs of some of our unsheltered residents at Mass and Cass. So, can we talk a little bit about the investment in Squad 80? Can we make sure that they're actively engaged, certainly in the work around Mass and Cass, this new pilot program that we should expect some information on? Can we explore non-emergency room transport when it comes to Squad 80? And can we make sure that Squad 80 in particular has an opportunity to really respond to the needs of the community that they serve, especially when one of the topics that had come up is their hours of service don't necessarily match the hours that our shelters start to push people out in the morning, for lack of a better term. So Squad 80 is what I'd love to hear about.
So I'll let Chief Hooley talk more in depth. I will say, Counselor, when we look at that pilot, obviously EMS plays such a critical role in getting people the medical care that they need, including Squad 80, right? I mean, Squad 80 was created to sort of address many of those issues that I know as involved as you've been. So, we are making sure that EMS is central to the response conversation, which includes Squad 80 and the work they're doing. I'll let Chief Hooley talk in more detail about Squad 80 and kind of where things are at, but I know how important they are to the overall process. So Chief, additional pieces you wanted to add related to Squad 80?
Sure, thank you, and good afternoon, Council. Yeah, a couple of years ago, when they started that Squad 80, it was principally to help free up ambulances from that might otherwise be tied up, to make them more available for other priority one calls. And that could have been anything. It could be like assisting somebody with a homeless issue, but it could be assisting somebody with a broken non-electric wheelchair or something else to try to free up an ambulance from a non-transport situation. It certainly has been evolving around a bit, only because of what we are experiencing in the again, as Councilor Campbell was saying, it's Mass Cass is almost a catch-all phrase now, because that's expanded so much more right now. And what the future role could be for perhaps another non-transport unit to assist to help more with some of the psychiatric type calls as well. I mean, Squad 80 right now, they do a lot of the leave behind not caring. They do a lot of things. A lot of their focus right now is with people who are having overdoses or some crises in the area here now, trying to hook them up to services, get them, point them in the direction where they're coming over to A-Hope or PATHS, trying to connect them with other counselors, working with the BPD Street Outreach Unit. Again, we are looking at something like that in this work group that's been going on weekly on these Tuesday meetings, to see if there's a way to expand it, and obviously would all likelihood have to add to it to be able to even to try to pilot something there, because there's enough work for I hate to say it, there's enough work for Squad 80 as it is right now with everything that's going on. We've before its role was to go all the way downtown to some places in the Back Bay, which is difficult to do because of some of the demands that are being placed on it, even just in the couple of square miles around here. So as we look into trying to do maybe some more work, maybe with BEST or with clinicians, or in addition to that, I hope hopefully within a couple of weeks, we'll be able to report out more with some of the efforts that we're looking to do to expand the role of that unit.
That's great. I appreciate that, and thank you. And I think, as a member of the task force and someone who's been actively engaged in a lot of this work, just, please count on me and rely on me for additional support, especially as we think about the funding needs that this work certainly requires. And, we know that all of the issues that are faced at sort of, when we think about Mass and Cass and the intersection of Mass and Cass, certainly the intersection of experience that happens at Mass and Cass. We talk about in a literal sense as well as in a figurative sense, for sure. And I'm certain that my time is up. I will say you have my support in promoting the upcoming EMS class. I think it's so critical that you do partner with Madison Park on creating a real pipeline. Many years ago, I know my early years teaching, there was a real relationship between EMS and Madison Park. Just count on my support to further and more deeply engage our young people in the city for careers in EMS with your department. Madam Chair, that's it for me. At least for now, I'll continue to listen in.
Great. Thank you so much, Councillor Sabi George. And then I'll ask my questions and then just check if councillors have any follow-up, and then we'll go to public testimony. So we are, turning the corner towards the end of this hearing. Yeah, thank you all so much, and for the extensive answers to our questions. So I'll try to only ask sort of things that you didn't already answer. I guess I was wondering, it's good to see the youth homelessness work formalized. I for several years taught a justice and housing class over at Harvard, and as a result worked with a bunch of the students who ran the Y2Y shelter in Cambridge. So I'm pretty deeply familiar with that model. And I know that we don't really have anything similar over in Boston, just because we all know that the youth homeless population is disproportionately LGBTQ. Just wondering how we think about that aspect of the work and what, if anything, we have in Boston to support that population in particular.
Yeah, great question, Councillor, and I appreciate that. I mean, Y2Y was a partner in the creation of they were at the table when we created the Rising to the Challenge plan to end youth homelessness in Boston. And of course, although different, Bridge Over Troubled Waters plays a critical role in engaging young adults and youth experiencing homelessness, as well as LGBTQ specific youth as well. What we've been trying to do in terms of the planning process and the partnership we've had between D&D, the Health and Human Services, and the United Way, and a variety of community partners, has been able to take the plan and tackle specific pieces to it. So one example of that work was to partner this year on the Health and Human Services side, was to provide a training series to providers very specifically to boost their knowledge, their skills and competencies on how to work with youth and young adults. Youth and young adults experiencing homelessness are sort of in a system that absolutely isn't made for youth and young adults. And so one of the things that the Youth Action Board, which was young people with lived experience with homelessness, was really to press to say, listen, if I go to an adult shelter, or if I have to go to an adult program, or I have to get my needs met, I need to know that they understand what does it mean to be 18 and homeless? What does it mean to be LGBT, person of color, and homeless? And how do I build capacity to be able to do that? So we used funding through the Rising to the Challenge plan this year to do a variety of a training series, all virtual, very well intended by community programs and partners, to be able to boost up competencies very specific that youth and young adults asked us to be able to do. In the Rising to the Challenge plan, there's a variety of strategies in that plan, including youth specific shelters, direct cash transfers for young people, very specific strategies that are separate from the housing piece of it that D&D is working on and the supportive housing that they're doing. That's really focused on how do we make sure that youth and young adults, like all people, their experience with homelessness should be rare and brief, and how do we get them into that pathway? So there's a bunch of legwork that's happening on our end in terms of health and human services. Obviously, so much of the work around homelessness in general lives under the leadership of Jerry Thomas. So Jerry, I'm just going to open it up, see if you had anything you wanted to add related to the youth and young adult homelessness.
The only thing I'd add, thank you, Chief, and thank you, Councilor Bach, for the question, is the commission, our shelters actually have the largest numbers of youth and young adults among the adult shelters, and we don't think this is a good place, but we have a very deliberate triage system with bridge over troubled water and helping youth get into a more appropriate setting rather than adult shelter like 112. And we are working with them around the 2 sites they set up in Mission Hill, which was, very sort of low threshold, small space, and more conducive to, individualized services. So it's an important group to focus on.
Great. All right. Well, glad to know that work is happening. Yeah, I just think it's so important. On the alternative response pilot, I just wanted to, so I guess this is a little bit of a kind of next steps request. So my office, we've done a bunch of research into sort of what alternate response models look like elsewhere. I think obviously a number of counselors Wu, Edwards, and Mejia proposed that back last summer. And my office lately, we've talked to Dallas, we've talked to Olympia and like Eugene and a bunch of places, somewhere in the Southwest. I'm blanking on right now. Maybe Phoenix. But there's a lot of in the weeds detail about what kind of works and doesn't. And I will say that there's been a strong push, obviously, from the advocacy community not to do a co-response model with police. I would also say that in our conversations with some of the others who have tried this, they started with a co-response and have now tried to move away from it and have found that to be hard to do, like to extricate themselves, but have found like they kind of wanted a different type of thing. So it seems to me that since we already have a co-response in the BEST team work, I would certainly articulate that I'd hope that this would be other than that. And I assume that's the direction we're going, but just, but I do think that one of the things that we heard, Emily, my policy director, will blame me for forgetting, which I think it was Phoenix, but there was a lot of outreach with community groups in the design in a bunch of these places. And I would just say, echoing Councilor Mejia, that like we've heard as counselors from a lot of those groups in the city saying, what are they doing? Like kind of like this sense of, hey, the administration proposed something that maybe looks like what we want, but it's a black box. And is it going to be that by the time we get brought into the conversation, a bunch of the details are kind of set? And so I would just articulate, Chief Martinez, that I think that there is a need there. Like it's a little bit been like, well, hang on, everybody wait the 90 days while we figure out our internal stuff. And while I understand how the city agencies are a world unto themselves to sort of pull together around these things, I do think that's something that we're hearing a lot of. And I think, to me, it's going to be successful with community buy-in, right? And we want it to be something that people are referring to. And I'll just say, I think it's extremely important that we do set up a kind of dispatch triage that goes from 911. I don't think there's any chance that you're ever going to popularize a number as much as, I think what we've learned is there are definitely other places that will have a number that service providers or others in the know can call to get around the 911 dispatch and still get to the service. But it seems like, really integrating it and making sure that that's not a stumbling block with our dispatch and BPD feels important. So I just wanted to say those things, say that we've got some memos and a bunch of notes on it that we'd love to send over. But also if you.
Yeah, I think we'd welcome that information, Counselor, and the community engagement piece is part of the process. I think it's trying to make sure that we're at a place where we have a real good sense of where we're headed. Because I also think the community engagement piece would also help to elevate we want to keep, one of the issues that has come up, just to give you an example, is clinicians have raised this, as has EMS. We have to be clear about the safety of these calls, who shows up and how we triage for safety, and how we made sure that a clinician is not showing up to a call that he or she is not able to deal with some of the safety issues that are there. So the triaging is important. I think also I'd love to share with community groups. I think our co-response model is great. It's very limited, right? So the notion of being able to scale that and strengthen the co-response model has also been something that's been articulated by clinicians and by our provider partners as well. So I'd love to be able to bring in the community piece. That is part of our intention. And if there's an additional information that you already have in terms of research that your office would like to share. So yeah, that is something we want to do, and we're eager to sort of have that larger conversation. I think what the city's trying to do is make sure we're clear about process, we're clear about systems, and then be able to share that. I think it was Councilor Mejia that mentioned it, to ensure that there's maybe it was Councilor Wu, that there's transparency about when a call comes in, what happens, who triages that. We're trying to make sure we're really clear about that in the process to engage folks. So I hear you, and that's something we want to do.
Great. We'll look forward to, further conversations. Just want to amplify that. I think another question not on this is just public bathrooms. It's been such a challenge throughout the pandemic. I know that, obviously I think the library just announced that it's reopening the central branch on June 1st, and then the branch library is a couple weeks later. And that's great. We know that's one of the many things that people rely on our libraries for. But it's just really underscored for me the fact that it's like a basic human necessity, and that it's not something that you should have to purchase things to be able to avail yourself of. And I have felt a little bit throughout the pandemic, city departments have not been eager to own bathrooms. And part of that has to do with because the recovery stuff, like the fact that, things need to be staffed and everything. But I do feel like we haven't fully, over the course of the year, stepped up to meet that need. And I was sort of shocked to find out recently that we've got, I did not know that we had, it's a whole bunch of street furniture, public bathrooms that are, they're 25 cents, but they're sort of administered through PFD that have been all shut during the pandemic. And I'm just surprised that conversation hasn't come up in the conversations I've had. But I know we've got some long-term things. I know that City Hall Plaza, there is a plan to have public bathrooms built into that. I believe the latest version of the Boston Common Master Plan has the same. But in the interim, if this summer, I can imagine a bunch of cafes staggering whether they're allowing people to access their bathroom. You know what I mean? I can just imagine us having this issue again. And I just, I wonder what we're doing about it in the short term for the summer, and whether it has made the Public Health Commission think about the need for a more permanent access to 24/7 bathroom facilities around the city.
Yeah, I think I appreciate the question, Councilor, because that's definitely an issue that has been raised. And I will say public bathrooms have always been an issue, right? I think COVID sort of shined a light on the fact that when things were accessible, no longer were accessible, and who they were not accessible to. It sort of changed that. And as we get out of COVID, people may decide, well, it was nice not having people use our bathrooms, right? So we're not going to open them, right? So that is a challenge. I think we've had some ideas and thoughts that just were thrown off there, and maybe some legwork was done on some of them. But what Health and Human Services has looked at, and we're going to partner not only with BPHC, but as you mentioned, bathrooms are a complicated endeavor. As we're going to we took a step to say, wait, how do we figure out how to make sure there's access across the city? What does that look like? We have a small pool of money in the budget around sanitation, and that's really intended to talk about what it might look like to create some access points. We have started some conversations related to the bathroom piece, but again, some of us have been in different cities across the country where they looked at public bathrooms in areas that were dealing with a variety of challenges, and they were very complex. They were difficult things to sort of manage and contract and staff, and presented new problems. So we're not against public bathrooms, obviously, but what the city is looking at this point is be able to understand what is the need, how do we try to meet that need. And right now we've had some band-aids on it, which are difficult, cleaning up human waste in areas and doing things that obviously are challenging, but they're things we need to do. So we are looking at it. I don't pretend to tell you there's a clear plan to create 24/7 access to bathrooms across the city. There isn't, but we know it's a need that that we need to address, and it's something that we're trying to figure out as we speak.
Yeah, I just think it's one of those things that like, it's so essential. Like it's so fundamental, right? Like, there's basically nothing more fundamental. So yeah, just that, I would just say like, count me as an advocate for us figuring that out. And I think it's just an important part of people's dignity in the city.
Appreciate that.
All right, I guess I'll just say, because I know we've run long, and I want to see if my colleagues have any last questions. I did appreciate the extensive answer on my question about the Native American Indigenous community. I just really feel, as I said in the question, that that because it's statistically small, that community gets they just get left out of a lot of conversations, and yet there's so many overlapping challenges that they face, and then also Boston acts as a hub for the larger Native community across the region. And I feel like, I think that we struggle with being a hub on lots of service fronts, but I think in the case of this community, whose land we sit on, we owe them a greater degree of solicitude, even if somebody happens to live across the border, right? In terms of it's a very small community for a lot of historical reasons. And so just really trying to amplify for lots of city departments, how are we being intentional about working with them? So I appreciated the extensive answers to that. And I guess just would encourage, if there isn't one already, sort of a proactive partnership with the North American Center of Boston, which is right at the edge of my district with Councilor O'Malley out at Heath Street. And then one very quick question that my staff just sent over to me was, one second. We have started to get the annual questions about requiring people's buildings to turn their AC on, because as everyone notices, may have noticed, it's been quite hot the last few days. And we've got a lot of constituents, elder constituents whose buildings have a policy, we don't turn it on until mid-June or whatever. And I know we talk a lot about heat effects and heat islands and all these things. And we all know elders are super affected by heat. Is there anything that the Public Health Commission has or can do on this in terms of providing buildings with advice of, if it's over 90, you should really maybe turn on the AC if you've got a bunch of vulnerable elders in your building? I'm just curious.
I think, we have the tradition of doing advisories, especially around really extreme weather, stretches of high temperatures, and working closely with the H-Strong Commission will be important, and other partners that serve folks, who are vulnerable, so we can, alert folks when those days are coming, and also on how to, who to call, because they can call 311, they can call the mayor's health line, and we can connect them to, folks who can follow up and help them with their landlords. So I think, continue to be intentional in getting the word out so people know what to do if they find themselves in situations where they're in a housing where it's intolerable and they need help with a landlord, which happens, often, unfortunately. So.
Great. Well, thanks so much. And I just want to echo all of the counselors on in the Herculean efforts that you all have made throughout COVID, and just I know that in some ways I worry that we'll, get everybody vaccinated and then you'll all collapse in a heap, because it's been pretty unbelievable. yeah, and hopefully we will all have a graceful way to do that.
It is unfortunate, Counselor, that the facilities at these buildings are tied into the date, not to the weather, right? So they're thinking, no, we don't turn on the AC or the heat until October 15th when it's like freezing in August. So it's like we're not adjusting to climate change.
Yeah, no, it's very frustrating for the elders, and yeah, and one of those just perennial things that we hear about. Okay, I want to just check. Counselor Edwards, I think, told me that she doesn't have any follow-ups. Counselor Asabi George, did you have any second round questions you wanted to ask?
I don't. Thank you for asking.
Great. And then the vacant building at 207 River Street, plans for anything? We got a list of your buildings, and I think it was 207 River. Doesn't know anything going on right now.
We'll have to follow up. We'll have to follow back up with you, unless Rita, you want to address it.
Yeah,
now.
that's an old kitchen building that it's been vacant forever in the Mattapan campus. And it takes a lot of resources to make it, come back to life, because it's been vacant for many years. So there are no plans at this point, but it's on our list. Yeah.
Got it. Well, I'm always interested in how we can use our public assets most effectively. So just had to ask you about that, and we can chase that later. Great. And then Chief Martinez, we will talk about this in greater length. Obviously, the administration's introduced an initial $50 million request for the American Rescue Plan. And I think 10 million of that is sort of public health bucket. And I won't make you do that hearing now. But I don't know if you wanted to preview for the council, just even broadly, kind of like what, and for the public, right, that watches these, what feel like the categories of where we could make substantial federal investment. Maybe, I guess there's a bucket of it that's just going to cover the one-time costs we have right now related to COVID. So maybe bracketing those, taking those for granted as an important category, thinking about what we've asked a lot of departments about is, okay, these one-time federal funds can be transformative, but also you can't set up like a permanent thing, like operating cost-wise. What feels useful? Where are you guys on that?
Yeah, I think it's a great question. The initial investment is really about, we're still in emergency response, right? So it might be sunny, it might be nice. The state restrictions might be getting lifted Saturday, but we're still in COVID response mode, right? So even our initial investments that we are focused on are around testing, still vaccinations, support around mental health, obviously supports around substance use disorder, et cetera. Even in some infrastructure pieces that we've seen, right? If, we've lived our life virtually like we are now. And so it makes you beg the question, how is that system for people, in our residential programs and our shelters and our spaces, right? So there's some immediate things that we're still like crisis stuff. But if we think about long term, we're really thinking about how do we look at the systems that have been impacted, the public health systems that have been impacted, and how do we strengthen those when we think about the dollars? I think we're really focused on ensuring that when we talk about an equitable recovery, that we're really clear about how do we not lose focus on the inequities that have got us here, the health inequities that have got us here. BPHC has been working on these. They've been a leader around health inequity for many years. And now with some federal funding, we may be able to actually systemically tackle some of those pieces that have sort of, been exasperated through COVID and made people have a much worse sort of experience with what's been, just a horrible year. So I do think that's what we're thinking about. But what I don't want to miss sight of is that we want to hear from the community. Right. That's one thing. If we have learned anything, it is in this last year that we really want to hear from the community and those most impacted. So we have thoughts, right? We have a set of health inequities that have shaped the experience that we've had around COVID. And now what we want to really do is use that lens to also hear from people as we think about the future investments that are there. But, I don't need to tell you what those health inequities are. Everyone on this call knows it, and everyone watching, we've seen it play out. And we just hope that we can figure out some real investments over the next several years that are going to help us tackle some of the things that have created the situation that we're in. So that's where we're at. So rather than this is specifically what we want to do, we know that community voice is going to be an important part of it, and we're eager to hear from people on it.
Great. Well, yeah, that sounds like a great ambition to try to think about how we really just change these things structurally. And I also just want to say before we go off the hearing, because it's something that I would have asked you about, and I know others would have asked you about if you hadn't sent us the answer you did. I mean, very glad to see the investment in more permanent staff infrastructure around infectious diseases. I think that so clearly is an area where we got caught out, frankly, right? With by COVID. I mean, both immediately in the sense that we didn't have a director of the Bureau, and also just structurally, like many public health departments around the country, like I think, that had just been disinvested in. And so, seeing you guys really say, hey, like fooled us once, but we're not gonna a second time not have that infrastructure is so important. And also glad to hear that it sounds as though the search for a permanent executive director is sort of nearing a final phase. Although I think, I definitely want to compliment Rita on all the work that she's been doing in the interim role. So very grateful for that, but it's good to hear that sounds like it's close.
We're all happy. We're all happy too.
Rita's looking forward to some vacation. Well deserved. All right, well, I think that is everything from the council. So I'll just thank the team for being here and staying with us. And now I will go to take public testimony before we conclude. So, got Emiliano. Emiliano, you're up.
Yes.
Yes. Can you hear me? I can hear you.
I can hear you. Hello. How are you? How are you, Councilor?
Great. Thank you for your patience. I'm sorry the hearing was so long.
Yeah, that's fine. That was very interesting. Thank you. So good afternoon. My name is Emiliano Falcon Morano. I'm the Policy Counsel for the Technology for Liberty program at the ACLU of Massachusetts. And on behalf of the ACLU and our more than 10,000 members and supporters in Boston, I submit this testimony to provide some comments about the fiscal year 22 operating budget in general. We are here to say that the city of Boston does not need to invest on new surveillance. We were shocked and dismayed this past Tuesday when Dick Boston reported that the city of Boston published back in April a request for proposals to dramatically expand the reach and power of the surveillance camera network throughout Eastern Massachusetts. The plan laid out in the RFP proposes to link over 1,000 surveillance cameras in Boston, Brookline, Cambridge, Chelsea, Everett, Quincy, Revere, Somerville, and Winthrop. It also proposes integrating different surveillance technologies like ShotSpotter devices and license plate readers into one seamless surveillance system. If the Office of Emergency Management, the OEM, effectively awards and signs the contract next week, anyone with login access to the system may be able to view real-time unrecorded data from any of its thousands of cameras and devices. And this would be accessible to potentially thousands of police officers throughout all Eastern Massachusetts, creating one all-seeing eye in the region. The City Council must urge the mayor to withdraw this RFP and not award or sign the contract. Surveillance isn't safety. The threats posed by a networked, invasive, and expansive surveillance system like the one planned by the city of Boston are too grave and serious to ignore. What the city of Boston needs is a surveillance ordinance. The OEM blindsided the city council and published the RFP as the council is in the final stages of working to pass a surveillance oversight ordinance. The ordinance would place decisions about matters like this before the public and in the hands of the city council. This shows that the budget process, as it currently stands, does not provide the councilors with an adequate oversight on how the city spends money. This is particularly pernicious when it comes to surveillance. For example, the expenditure related to the RFP is not mentioned, to our knowledge, in the city's budget for this year. Today we heard how all these agencies in the city have been spending money in the health crisis that COVID represented to the city. We need the same for the police department. Moreover, where is the money for this RFP coming from? Who decided that this dramatic expansion of surveillance in Eastern Massachusetts was needed? Why are all these technologies going to be integrated? Who will have access to them and under which conditions? The OEM should have answered all these questions to the City Council and the public before publishing the RFP. The decision about whether the OEM or any other local agency should use surveillance technologies, and if so, how and under what circumstances, should not be made in secret without any public deliberation or debate. These decisions must be hashed out in public and driven by elected officials informed by their constituents and expert testimony. A surveillance ordinance like the one this council has been working for a couple of years with immigration, civil rights, and civil liberties advocates would provide answers to these questions because it establishes a concrete mechanism to preserve transparency, accountability, and oversight. For now, the mayor must withdraw the RFP and not award the contract. Last year, people marched in record numbers to demand justice for Black communities long subject to police violence and surveillance, and an end to racism and white supremacy. The city of Boston took an important step towards reining in an accountable government spying when it banned face surveillance. Now the city should continue on that road and join other cities in Massachusetts, including Somerville and Cambridge, and pass the surveillance ordinance before the city council. Until then, no new surveillance should be acquired or expanded. We urge the City Council to urge Acting Mayor Janey to withdraw this nefarious RFP so that the OEM does not award or sign the contract. Thank you very much.
Thank you, Emiliano. And definitely, yes, the issue's been brought to the council's attention, and we asked police about it yesterday, and I think we'll be following up. So appreciate you, again, waiting and testifying. I think that is the only public testimony that we have. I did have one other sign up, Maria Termini. I don't see her on the Zoom, but I will just say that I know that if she were here, she would emphasize the need for public bathrooms and the sense that we should have had a 24/7 public bathroom on the Common many, many months ago. And I appreciate her strong advocacy on that. I just want to vocalize that here. All right, with that, I am grateful to, again, to the whole Public Health Commission, to EMS, Chief Hooley, thank you, and Chief Martinez, and to my council colleagues for joining today. And with that, this hearing of the Boston City Council's Ways and Means Committee is adjourned. Thank you all.
Well done. Have a good one.
Thanks.